is 9 o'clock, and we are going to get started. We were in recess, so we're not going to do intros or anything like that. We're just going to go ahead and get back into day 2 of this fall retreat. I'll turn it over to LaShawn Carter at this time.
Thank you. Like yesterday, we have a morning exercise by Rebecca Herbert to get us going, and then from there, we'll jump into the agenda.
Fantastic.
All right, good morning. So it is a quiet, rainy, cold Tuesday. So before we do anything, I'm just going to ask, and I'm going to get eye rolls from some of my pals at Budget because they make fun of me, but we're going to just do some gentle stretching in your spot, okay? If you feel inclined to stand up, you can do that too, but I'm not going to make you. So just kind of like this, right? A little bit. Okay. There you go. See, I'm gentle and nice and not goofy. No trust falls. I've already said that. So just wake up. There is data for my data people that the more we move and engage our muscles, the smarter we are. So if you feel, look at Commissioner Griffin, there we go. All right, yes, there we go. Thank you very much, appreciate it. And then you can sit back down. There you go. So when you get stumped, just start doing jumping jacks. All right, so to get us started on the second day of the retreat, again, our focus is relationship and results. Relationship with everyone in this room and outside, and results, ultimately to improve the quality of life in our community. So to get us started this morning, our exercise is what's known as an appreciation loop. And as the name indicates, it is where we declare our appreciation for someone, for an experience, for learning. It really can be anything and everything. But the way we're going to do this as a group, when I break us up, we're going to do 4 small groups around the room. And as the name indicates, kind of gather in a circle or a loop shape. And when it is your turn to speak, emphasis on when it is your turn to speak, these are some ideas for you to think about. You might want to offer appreciation for something you learned yesterday, day 1 of the retreat, because the scope is the retreat. So something that you learned yesterday. Maybe something that you knew about, but now you have a better understanding of. It might be appreciation for a connection that was made. So you got to connect with a certain person in this room that you've always wanted to, or that you never knew you wanted to. Or you connected with learning. Maybe you had a blind spot, and yesterday afforded you an opportunity to make a connection between impact and effect and all of that. Or maybe you have inspiration and your appreciation for that yesterday's experience inspired you. Maybe it lifted you up. This work you do is hard. Everyone talked about that, right? So maybe the appreciation was for a moment of inspiration. So I'll kind of go into the instructions. As I mentioned, we will break into 4 smaller groups. When you are in your loop, we're going to practice the behavior of a talking stick. And one of our colleagues laughed because she said, when she saw me yesterday, she said, "Where are the tennis balls?" And I said, "Oh, I'm going to be serious today. No tennis balls day 1. Tennis balls day 2. Tennis balls are the talking stick. Okay, so when you're in your loop, only the person with the talking stick speaks, because we are going to work on our listening. You all did a great job yesterday listening to one another. We're listening to understand, not listening to respond or fix or correct. So this morning's exercise is a practice in our listening. So only the person with the talking stick speaks. When you assemble into your groups, we're going to break into 4 groups. Only the person with the talking stick speaks. When it's your turn, you're going to share something that you appreciate about day 1. Let's take about 1 to 2 minutes. Okay, so we've got to get through everybody and get going with day 2. So about 1 to 2 minutes. And as I mentioned, you consider something you learned, someone you met, or something that inspired you. And mind the timer. So I will give time updates. We will have about 12 minutes. I'll see where everybody's at, and then we'll get going with day 2. Any questions about this exercise?
Are we going to people
So I'm going to count you off. We'll have 4 groups, and so that's a great question. So yes, part of this is getting to know people in the room better. If for some reason you end up in a group with everybody you know, jump into another group. I'll let you self-regulate, because again, we want to get to know people in the room. All right, ready, set? So I'm gonna, I tell you what, I won't count you off, but let's try this. I need 4 volunteers to raise your hand. Don't be afraid, you're just the host. Thank you, look at this, okay. So, you will go stand right behind Commissioner Griffin and Commissioner Lee. That'd be great.
Stand right behind me.
There you go.
Uh-oh. Don't throw the ball.
Right there? Right there. Volunteers over here. Everybody's avoiding eye contact with me. Okay. Nick, thank you. All right.
You just hold on to it.
SRM, can I?
Oh,
Thank
I
you.
was just stretching. I
Oh,
was
well, like at an auction, be careful. All
Voluntold.
right, okay. So these are your loop host. So loop host, everyone else just join where you would prefer. So just join into, go to one of the hosts. We'll assemble, kind of give you a minute. And assemble into a loop or a circle, if you will. All right, and before we get started, I just want to make sure the size of our loops are about balanced. Where's the big one? Okay. All right. All right, we're kind of balanced. Okay, commissioner's coming over here. All right, so host, raise your tennis balls or your talking sticks. Thank you. All right, so host, if you would like to kick off and go first, you may, or someone else may volunteer. Here's the fun part. If you want to toss across, you can. Who remembers that game? Toss across, okay? If you want to just be that person that passes, you can do that. If you feel inclined to just chuck it at a colleague, I'll leave that to you and HR. All right, so, but the point is, everyone needs the talking stick. We've got about 12 minutes on the clock, so we're going to share your appreciation for part of the experience. Again, something you learned, someone you met, a blind spot removed. Were you inspired? Any other questions about what we're going to do? All right, host. Let's go. to just manage your time. We're about at the 8-minute left. If you didn't get to share, please, everybody got to share? Okay, great. So please go back to your seat. Oh, thank you. Yep. Oh, handed. No, I mean, that's good though. That's good. That's a great look. Thank you. Thank you. There we go. So as we come back to our seat and get ready to hear Adrian's presentation, I'm just going to check in with the commissioners and ask commissioners, is there anything you would like to share that you either said or you heard during those appreciation loops? So Commissioner YTI and then SRM, you're on deck. Yes, ma'am.
I'm already standing up. I mentioned that,
So we're back here, everybody. Okay.
so all of the subject matter experts, I've always said that, and I brag to the community always about how hardworking, dedicated, and like intentional our county people are. And our medical director, who I met for the first time, spoke to that. But also, I wanted to give kudos to Angie, because yesterday, even in the midst of stuff, she literally pulled my hind end out of fire and found me a place to have a town hall. So I was very, very appreciative of her. And I just enjoyed getting to know everybody and just a little something about just what they did.
Thank you. Thanks for going first. SRM and then Commissioner Meyer. Yes.
Okay, and I don't want to dob anybody in, so I'm going to, one of our subject matter experts said that it was very interesting to be hearing from us, and this subject matter expert learned that there might be some more learning that needs to be done because they learned like, okay, we might need to spend a little more time on that if that's what y'all are thinking, is, you know what I mean? Like, we might need some more help on some of our subjects. So I thought that was a great, honest answer.
That is an honest answer.
But it's anonymous. I'm not even letting you know what gender or what department or anything.
Wow.
But it was great.
That's real.
In our group, we expressed appreciation for the willingness to do something different. And, not just us willing to do it, but staff willing to listen and kind of be amused at the same time. But, yeah.
It's okay to enjoy yourself at work.
That's right.
It's okay.
That's right.
Any other thoughts from our commissioners about the appreciation loops?
I'll just say I really enjoyed getting to know some folks on a deeper level. The question around who do you most admire, most inspires you? Dr. Campbell talking about it was your father, right? And Dr. Owen talking about his mother. It was so moving. I didn't see it coming, and the details around loving and intentional parenting was just extremely moving. So I love getting to know folks better. Thank you.
All right. Well, thank you all. Have a great day, too, and I'll hand it over to LaShawn.
Thank you. Thank you, Rebecca. Just a final reminder of our working agreements yesterday, remembering those and thinking about, the things that we need from each other, and the themselves in this conversation will keep us in that safe context. So just a reminder of our working agreements from yesterday, and I'll turn it over. We can jump right back into the agenda.
All right, I think it's Adrian is up.
All right, just a moment. All right, so good morning, everybody. Good morning. For many years, the county has engaged in funding organizations that support our strategies and serve Mecklenburg County residents through our competitive community service grant program. As you know, the program is paused for 2026 due to funding constraints. This has provided us an opportunity to assess the design of the program, and today I'm going to share some strategies for your feedback and consideration. So first, I want to touch briefly on the history of the CSG program. I'm going to highlight some of the challenges and opportunities that we face, and then I will review our recommendations and next steps. Prior to community service grants, the county had what we called OSAs, or outside service agencies. These organizations included several nonprofits, as well as the lake commissions and our funding for the arts were all classified as OSAs. In fiscal year 2005, as we went into fiscal year 2006, the county developed a competitive grant process. The outside service agencies were removed from department budgets, and the competitive grant process, with oversight with our leadership teams, became the county's approach to funding these organizations. In fiscal year 2010, the name was changed to Community Service Grants, and the process was expanded to include information sessions and a review panel of subject matter experts. In fiscal year 2012, the grant program was aligned to the county's critical success factors. In fiscal year 2016, we increased requirements for audits to require that they were performed by a CPA, aligned to general accepted accounting principles, and that organizations could not have any overdue taxes. In fiscal year 2017, the county established a sunset policy. The policy limited eligibility to 3 consecutive years, so after 3 years of grant funding, organizations were provided the opportunity to apply to become a vendor that was aligned to a department's strategic plan. This was meant so that they would be assessed by the department, but they would no longer compete through the CSG program, and it was intended to open the program up to more organizations. That year, 15 CSG programs were baselined in department budgets, and more have been added since then. In fiscal year 2019, the grant program shifted to align to key themes of the county's strategic plan. In fiscal year 21, the county began funding the Unite Charlotte program through the United Way, which provides funding along with training for smaller grassroots nonprofits. And this year, community service grants were paused due to limited funding. This reduced the budget by $2 million. At the same time, Unite Charlotte was also reduced by $1.4 million to a total of $1.8 million, which is currently still in the budget, scaling the program back from 3 cohorts to 2 cohorts a year. Over the years, 22 different grant programs provided by 20 different organizations became vendors within our departments. That is to say, they were once considered community service grantees and have now been baselined in the annual budget. This slide shows a list of these programs with a total budget allocation of $4.8 million. I would also like to point out that there are other nonprofits that we contract with for distinct programs that they implement separate and apart from the county operations. Here is a subset of those programs that the county began funding because they addressed very specific needs, but they did not come through the CSG process. And this is not an exhaustive list, but a subset of the ones that kind of function this way. I also want to be clear that when we talk about community service grants, these are different, albeit very similar to the typical run-of-the-mill vendor. Grants are for individual programs that are executed on a time-limited basis. There are specific outcomes that are defined by the grant. These are usually for new programs that a nonprofit is considering providing. It is a competitive grant process. Applications are vetted by an expert of panels, and we use an exhaustive rubric to assess these programs, and the grants are paid as the results are achieved. The county has hundreds of vendor agreements. Departments will often utilize vendors to fulfill specific need of their operations. They are selected through a competitive procurement process. Some contracts are based on per unit basis. Some may be based on performance. And there are lots of different ways that we structure vendor agreements or contracts. Neither the grants or the vendor contracts are meant to support the general operating of an outside organization. In both cases, the funds are provided in exchange for an agreed-upon deliverable or a result. So as we've been on pause this year, we have had an opportunity to look back at the CSG program and consider how we might move forward with the program while addressing some of the challenges and opportunities that we have observed. Here are 6 of the most significant opportunities that we've identified with the CSG program. First, there is currently no funding for CSG grants as we go into fiscal year 27 because the funding was eliminated as part of our reductions for this year. Also, over the years, the CSG program has resulted in increasing the ongoing cost to the overall budget, especially with changes like the 3-year sunset policy that opened the door for CSG programs to receive funding separate and apart from the grant process. The CSG application process has always started with a call for applicants in the fall, and then grants are awarded to organizations with the adoption of the budget in the upcoming year. Because we accept applicants or applications at the same time that we are developing the budget, we're never in a position to tell potential applicants how much funding is available or to provide a lot of direction on the size of the grants that we will accept. We've heard this from several organizations as a source of frustration, and in the future, we'd like to provide them with more clarity around the available funds before they start their applicants. We believe that there's opportunity to better align the CSG program with the county's objectives by providing more specificity about the community outcomes that we're trying to improve. We also recognize that it's important to maintain a competitive process. This allows us to ensure that we're paying for the best results for residents. And lastly, we want all of the organizations that we work with to be successful, and this means having some controls on the front end of the CSG process to ensure that any organization that receives a grant is well positioned to use public dollars and can meet all of the requirements that are entailed with the grant. So with those challenges in mind, here are some strategies that we propose for the CSG program going forward. So first, we recommend that we end the practice of sunsetting CSGs every 3 years. That began in fiscal year 2017. And we require all organizations that were former CSGs to return to competing for funding through the grant process. This means that the CSG process would no longer have a 3-year limit, and there would no longer be an option to apply for a vendor at the end of those 3 years. It also means that the 20 organizations that have programs which were former CSGs would need to compete for funding along with other nonprofits that might apply through the CSG process. The sunset policy was intended to allow for more funding to go to new applicants each year. However, in practice, many of the sunset CSGs simply became vendors with baseline funding, and even though departments do work to assess their continued effectiveness each year, these programs no longer compete in the CSG process, and county dollars have been used to fund them on an ongoing basis. This practice has ballooned the budget for nonprofits. Ending this sunset process would make the program more competitive. The clearest drawback to this change is that organizations that were former CSGs would now need to adjust to a competitive funding process each year. We would, of course, notify the organizations of any changes with plenty of time for them to pivot. Next, we recommend that we establish a practice of funding the CSG program with fund balance based upon a predetermined percentage of the balance that is available above our threshold from the last year. And here's how that would work. So usually around late fall, early winter, as finance closes out the books, we know for certain what the final available fund balance above our policy minimum was for the preceding year. Using a small percentage of the available fund balance to fund the upcoming CSG cycle would then serve as a source for the program, with the understanding that grants are only awarded on a one-time basis. On this slide, I have included an example using 5% of the fund balance over the minimum fund balance policy. The teal table shows our year-end fund balance above our minimum threshold. The gold table reflects what 5% of that funding would provide for the upcoming fiscal year. And you'll notice that the timelines are offset. So if you look at fiscal year 2020 to the left, you will see that we ended fiscal year 2020 with $106.4 million in fund balance over the policy minimum. We knew what that number was during the second quarter of fiscal year 2021. And in this example, 5% would have provided $5,320,000 to fund the CSG program going into fiscal year 2022. In the gray table below, I've included the actual funding that we provided to CSGs and the programs that were formerly CSGs for a comparison. We have not finished the financial statements for fiscal year 2025 just yet, so I'm only showing the numbers that we had back around June and July as an example for fiscal year 2025. We expect that the final figure for fiscal year 25, using 5%, would yield funding that is at least equal to the current funding that we have in the budget for the programs that were former CSGs. There are some benefits to this approach. First, the strategy would reinvest a portion of our fund balance back into the community through the CSG program. Using fund balance also means that our annual ongoing county dollars would go to support the core county services that we provide rather than a grant program. In other words, the amount of money that the county gives out in the form of grants would be based on how much money we had available. This approach also opens up options to conduct the program on a different timeline, and I have another recommendation where I'll talk about that. There are a few potential drawbacks that we should all be aware of if we proceed with this approach. It involves the repeated use of one-time funds, and there may be a year in the future where it is no longer available for CSGs. However, based upon our history, we are confident that we have flexibility to use a small amount of fund balance in this way. If fund balance were to drop below levels that allow us to continue offering a grant program in the future, we would communicate early with potential applicants, and we would know that early. Also, because the strategy depends on adhering to a predetermined amount, it will require discipline to hold to the percentage and not to add just one more grant to the approved list. So the application process for CSG, it could be redesigned to be more intentionally focused on the community outcomes that we are trying to address. So in prior years, the applicants were asked to apply to programs that align to four core goal areas of our community strategy, such as connected community or healthy community. Nonprofits would attempt to identify program outcomes that tied to these goals. With this proposal, I recommend that our new process would intentionally identify the outcomes that we want to improve on the front end of the grant program. Nonprofits could apply with programs that demonstrate either direct or indirect improvement to these outcomes. For example, our list of outcomes might include specific health metrics we would like to see improved for uninsured or underinsured residents. Programs that could directly or indirectly improve those metrics would be good candidates for a CSG, and they'd be considered based on their ability to impact those outcomes. This approach would provide more clarity to applicants about what we are trying to achieve. It also allows the county to be more intentional in aligning to the areas of greatest need, and it builds upon our philosophy of paying for results. One of the potential drawbacks is that it will take some time to compile a robust list of the outcomes that we would want to use for this program. But as you heard yesterday from Michael Griswold, he and his team are already working on putting together a list of outcomes. Another tactic that would benefit the CSG program is to establish funding minimums and maximums. Setting grant maximums would help to ensure that large applicants do not monopolize the available funding. Also, very large and expensive programs are likely to require more discussion at budget workshops, and they may not be best suited for the CSG program. Minimums, on the other hand, would help to ensure that applicants include programs with significant impact, adequate funding for implementation, and the appropriate framework to report on performance. In recent years, the CSG program has had far more applicants than the county can fund. Setting minimums and maximums can provide clarity to applicants on the general size of the programs that work well as a CSG. For smaller programs, it should be noted that the county also funds the Unite Charlotte program through the United Way, and they provide grants or will provide grants of $35,000 or $55,000 along with training. Also, the budget for fiscal year 2027 could include a contingency allocation, and this would allow the board to invest in small one-time programs that might come up throughout the year. The use of funds from a contingency budget can only be approved by the board, but it does not have to be a restricted contingency that is restricted for a specific purpose at the front end when the budget is adopted. A contingency of $125,000 was previously included in the annual budget, but it was eliminated in fiscal year 2020 because of underutilization. There are some potential drawbacks to this recommendation that I want to call out. The alternatives for smaller organizations such as Unite Charlotte and reestablishing a contingency fund are an important feature. Without these alternatives, smaller organizations may unintentionally be excluded simply based upon their size, and that is not what we intend. So we want to make sure that those are in place. The next recommendation that I have is about the timeline for the program. If the board is in support of the proposal to use a predetermined amount of fund balance for the CSG program, then we can operate on a different time frame. The board could allocate funding first to the total CSG program, and then we could award specific grants later in the year. I've included a recommended timeline here on this slide. First, sorry, my screen went away. First, funding based upon fiscal year 2025 year-end available fund balance would be included in the budget for fiscal year 2027 as a total amount for CSGs. We would then begin accepting applications in July after the budget has been adopted. In September, we would close the application and we'd begin the process of reviewing all of the applicants and preparing recommendations for award. This would put us in a position to update the board and to draft contracts in December and January. Grantees could begin implementing programs on February 1st, 2027. Funding would then be determined for the 2028 budget based on the percent of fiscal year 2026 available fund balance. So one of the major benefits of this approach is that it separates the board from potentially being in a position to have to pick winners or losers during the budget process. Instead, the process would work much like the ARPA grants that were provided, in which the board approved the program and the budget as a whole, and then county staff using the review process would identify the grants later in the year. Also, application submission and review activity occurs outside of the time when we're working through all of the other budget decisions. This would allow us to have more intentional focus on both the budget decisions for the county and the CSG program. It would also allow organizations to potentially respond to any gaps or any issues that came up during the previous budget cycle. And it would allow grants to be awarded beginning as soon as February 2027. One of the drawbacks to this timeline is that we would only be able to communicate the total funding going to CSGs in the annual budget, not the specific funding to specific grants at the time that the budget is submitted. All right, the last recommendation that I have is that we consider the option of 2-year grants. Organizations would apply for programs that can operate on a 24-month period from the timeline when the award is made. When the county makes these awards, funding would be committed up front so that it is available for the life of the grant. I've included an example of how this would work just using some made-up numbers here. You can see that we would still award grants each year, with the first group beginning in February of next year and concluding January 2029 on a 2-year cycle. We would continue offering grants, so another group would begin February 2028. Providing 2-year grants would give grantees more time to achieve results. We may also receive better applications because multi-year grant could be more feasible for some programs than a 1-year grant. It's also important to note that we would continue to monitor performance over the life of the grant, and we would reserve the right to terminate the grant if it became clear that the organization is not abiding to the strategy that they put forward. There are a few drawbacks to allowing 2-year grants. 2-year grants use a greater share of the available funding. We also make CSG applicants aware that the community service grant should not be used to create a dependency on county funding. However, this may be more likely to occur with a 2-year grant. Also, internal review process has potential to be more complicated for us once we start looking at two-year grants. Here's a summary of the proposals and how they address the opportunities that I mentioned at the beginning. Eliminating the sunset policy and requiring former vendors to compete will ensure a competitive process, and it can help to prevent the grant program from ballooning the budget. Using a preset percentage of available fund balance provides a funding source for CSGs while also controlling the impact on the budget in the future, since it is tied to available fund balance. And it provides more clarity to potential applicants on the amount of funding that we will award. Focusing the application on specific outcomes will provide greater clarity to applicants, improve alignment to county objectives, and it will ensure a competitive process, since the desired outcomes will be clear on the front end when they're making their applications. Establishing minimums and maximums provides clarity to applicants, helps to ensure a competitive program, and it helps to ensure that grantees will be successful. Allocating the funding on the front end will help improve alignment to objectives by providing space to assess individual applications outside of the budget process, and two-year grants will make it easier for many grantees. So here are some next steps. Pending the feedback that we received today, we can draft a CSG guidance document to document everything about the program. Once decisions are final, we would notify organizations of changes. The recommended budget for fiscal year 2027 would include a fund balance allocation to support the CSG program. Michael Griswold and his team will develop a list of community metrics to use for the first cycle, and we will update the application and submission portal, and we would begin accepting applications mid-July. So those are the proposals that I have to share with you all, and I welcome your all's feedback.
All right, so I know that there's going to be a lot of feedback. What I would want to tell my colleagues is this: it's a lot of information to react to right now on the spot to give feedback. What I want to do is reserve the right, depending on the comfort level of my colleagues, to come back and even go again in a budget policy meeting to go through this again and give it a little bit more time to absorb, as opposed to just saying feedback now, come back with a draft. So I'm going to put that out there. We'll see how we land as we go through our questions. Madam Clerk, it'll be 3 minutes. I saw Commissioner Rodriguez-McDowell and Commissioner Dunlap.
Mr. Chair, can I make a comment before
Please.
you engage the board members? To your point, seeing this for the first time and needing some additional time to process, I respect that. However, it is really important that we receive your feedback, because if your feedback suggests that we go back and consider another option, the clock is ticking, and we're preparing for the upcoming budget cycle as we speak. As Adrian's presented to you, this is a very different process.
Yeah.
From the funding source, from the scheduling, as well as the role of the board. So certainly you should have sufficient time to process this and provide sufficient feedback to us, but we need to balance that with the timing of us preparing for the upcoming budget cycle.
Yeah, that's more than fair. So essentially, what I heard you say was, hey, if it's possible, we might have to ask you guys to come back with something different depending on the comfort level. So I respect that. So let me go with Commissioner Rodriguez-McDowell and Commissioner Dunlap. 3 minutes, Madam Clerk.
Thank you, Mr. Chairman. Thanks, Adrian, for this. I have a few questions, and one question I'm unclear about is, do vendors go away? Do we, help me understand what the role of vendors are?
So, of course, we do have vendors throughout the county for lots and lots of different things that we are doing. The only thing that I am suggesting today, let me see if I can find the slide for you so you got a reference point, is that these particular vendors that used to be community service grants, that they would then go back to the process of competing through the CSG.
Okay, so they have to go back to competitive as opposed to knowing that they're getting funding as a vendor.
That's right.
Okay.
And there are other vendors that kind of feel like CSGs, and we would have to go through and make sure that we would have to assess those separately. But at this point, this is all I'm speaking of.
Right. Well, so at first blush, the way that this falls on me is that I worry that the nonprofits would be weakened by this, because I feel like it seems like they wouldn't be able to depend, and I know I've heard you say it over and over, like they shouldn't be depending on county funding for their survival, but we have nonprofits that are literally doing the work that we need done for our community, right? And so this idea of weakening them, I find extremely concerning. And maybe I'm wrong about weakening, but that's how it looks to me, that they wouldn't be able to, I know if hang their hat on, okay, we're standing up a program, and I know that you had a 2-year option, but it seems like it just sort of pulls the rug out in my mind. And like I said, I'm open to being wrong about that. But can you also clarify on page 194 where you're talking about Unite Charlotte? They're using their own funding, not our funding for their grants, correct?
So Unite Charlotte is fully funded by the county. I don't believe there's
fully
any.
funded,
Yeah, there
okay.
is no other funding source for Unite Charlotte that I'm aware of.
Oh, okay, so it's not the United Way. I didn't know this term of Unite Charlotte versus United Way. It's separate.
Unite Charlotte is a program managed by United Way.
By what?
It's managed by
it's
United
managed
Way,
by
but
Uni-
it's funded by the county.
That's right.
So it really takes away the county's direct sort of involvement. It's sort of subcontracting it out to this other group to make the choices of
Keep going.
the grants.
That's a fair description of it. They are making the grants. They have staff involved. They have a board involved that makes the grants to these smaller organizations.
But they are a county,
They are funded by the county, yes.
are they a nonprofit or are they a county department?
Neither. They are, they're a nonprofit. It's United Way.
It's just like we have funding and correct me if I'm wrong here, Adrian, but I think it's just the way we have, the way we administer programs, say like for the federal government or for the state, there are certain programs that we administer. They're essentially administering the program on our behalf.
Okay.
So that it allows our staff not to be.
Oh, okay, gotcha. All right, thank you, that's helpful to understand that. I got a lot of questions, but
So,
I love your idea of going deeper.
Yeah, and we may have to do a round 2 depending on time check and all that stuff, but definitely, let me just see if we can get through everybody first.
Yeah, I had quite a few too. But Unite Charlotte is the money we give, and the reason we did that, because you were here, was so that we could strengthen nonprofit organizations. The CEOs or presidents of those nonprofits had to go through training in order to get those grants. So
Right.
that's why we did that. Because we found out that a lot of the nonprofits, lower-level nonprofits were failing, and that was a way to strengthen them, make sure they did their paperwork right and stuff like that. The 125 that was removed for unutilization, and part of that was that I don't know that we really understood that, and we were always waiting to see if, well, do we use the 125 for this organization, or do we use the 125 for that organization? Is it worth taking the 125 out? I don't know that I would have necessarily done away with it, because there might come a time when we miss something, and rather than wondering where the money's going to come from, that 125 was already there. The fact that it was never used is not really a bad idea.
In addition to the underutilization, also the board shifted to an interest in spending down fund balance as well.
Okay. When you talked about the funding cycle starting in February, was there any consideration given to the funding cycle for the nonprofits? Because I think most of them were on like an annual basis, either July or January or something like that.
Ask your question again. You're talking about the term of their contract, or?
Not the term of the contract, the funding cycle for the nonprofit.
For the nonprofits, not the CSGs.
Right.
For the nonprofit itself.
Well, nonprofits in general, most of them came when we did our presentation in September, knowing that it was going to be discussed, they were going to be funded July 1.
Yes,
So their budget cycle started July 1.
yes.
Some of them have a funding cycle that starts January 1. We have proposed a funding cycle for them that starts February.
Right, and the reason for that is because of the alignment with some of the performance data that OSI will be assisting us with. It would align perfectly in terms of tracking their metrics.
Okay, the 2-year cycle, fine, 2-year cycle's fine. On the second year of the 2-year cycle, we're still funding, because we got the 5% if we use the 5%. We're still funding. Will the people who applied and received grants the first year be able to apply on the second year?
Yes, we made no decisions to preclude anyone from applying from that subsequent year if they receive funding.
All right? And then, my other comment is, I don't have a problem with the vendors going back into the pool, but when you look at the significant amount of money some of the vendors are receiving, it appears to me that there ought to be some kind of categories, because to go from $600,000 to something substantially less, because you're now back into the pool, could be substantial for some of those organizations.
With the exception of Medisys, the others would fall into the range that we're proposing, as little as 55 and as much as 500,000.
Say that again?
With the ranges that we're proposing in terms of the cap, we're suggesting that the grants will be from 55,000 to 500,000. So
Okay.
Medisys is the only one that will be above that range, based on the current funding.
All right, Commissioner Altman.
Thank you, Mr. Chairman. Mr. Manager, I appreciate always how we get our presentations in a fairly neutral, even-handed way, but I would like to know your opinion. I'd like to know more directly what you recommend and why.
Well, this is my recommendation.
And why?
There's a couple of reasons why. One, it's more predictable in terms of the funding stream. We will know, based on the percentage, as Adrian outlined, what the dollar amount would be designated for funding nonprofits. Then the second part of it is, once that funding stream is approved, we can look at the performance measures. We talked about the scorecard yesterday and identify the metrics that we want to gear our process towards in terms of where there's opportunities to improve. Then the other part of it is, as Adrian mentioned, the board will not be in a position to select winners and losers, for lack of better wording, but instead it will be solely based on metrics that we will come back later in the year to present to you during that date in terms of what our recommendation is. So the predictability I like in terms of revisiting your role in the process, I like as well. The 2-year process, for those that receive funding, we learned as part of the ARPA process that it takes time, particularly for new recipients to stand up their programs. So to limit them to 12 months could be challenging for some. So it'll be reviewed on a case-by-case basis, but they will have an opportunity to receive up to 2 years of funding.
And what about the concern raised about the challenge this poses to nonprofits? What's your response to that?
I respect the challenge, but I also stand firm that, as we've said in the past, they should not rely on county funding to operate. Because this is where you get that long list of vendors, of agencies that have received funding for quite some time, and we find ourselves back at square one. I believe that we do a really good job during our orientation and partnering with the nonprofits to assist them with decreasing their reliability on county funds, because just like this year here where you had to eliminate funding from the CSG process, who knows what may happen in subsequent years as well. So the reliability on community service grants to rely on our dollars, I don't think is a good practice.
Yep. Well, I do consider you incredibly knowledgeable, and I am interested in giving a try to what you and your team have proposed. I know that you're your vested interest above all is to use the precious dollars we have the most good. And I appreciate you coming up with a new approach, and I support you in that.
Thank you.
Give me 1 second, Arthur. Let me finish off everybody to the right. Let's go with Commissioner Powell, then Commissioner Meyer, then I'll come to, I'm coming to everybody on the left.
Okay.
So thank you for your presentation. I have my notes, and they kind of match what County Manager said. It seems like there's an increased level of scrutiny, which I think we need. It seems much more fiscally disciplined, predictable. I love how we really need to have a focus on tracking metrics. I think that it's like we need to do better on that. We need to have less of like at the last minute, oh man, one more grant. Like everybody up here, when you said that's a risk, like what are the downfalls that you can't have, here's one more that we have to add. And I love that you talked about learning from ARPA because, just from what I had to deal with in ARPA, was like so emotional from the nonprofits. I love that you've woven that into this so it never becomes that way again, because you can't rely on the funding. It could be gone, especially in this atmosphere that we're in. So unless somebody says something that really changes my mind, I support this. Thank you.
Thank you. Commissioner Meyer.
Thank you. So on this list, I see, Care Ring is twice because they have two different programs. But are there any of these that we fund in anywhere else in the budget? Like Care Ring, we fund them separately, don't we?
So there are some of these organizations have separate agreements, not for these specific programs, but they may have separate agreements as vendors. So I know that from time to time, Health Department might contract with C.W. Williams to do some things. So they have different general kind of contracts with some of these folks.
So if this goes away and they have to go back to being competitive, that still stays, those contracted out.
That's right. We're not necessarily talking about any changes to any of the contracts that.
So the contracts stay?
That's right.
Okay, because they're doing the work, okay.
This is just about the program.
The programs that they're doing, okay. I also like the 2-year option. I think that gives these nonprofits more of an opportunity to do the work and to show their results. And it seems like, do you think the oversight is about the same as before? Because it seems like you're adding a lot of work to you guys to oversee this.
We did discuss that this would require an increase in our workload, but we think it's worthwhile, particularly when we are connected to the desired results in our scorecard. And it's very important that we can articulate what that return on investment is, but we'd rather do it on the front end as opposed to it getting buried in our budget later on and then having to go back.
Okay. And in whenever we do this, do we ever claw back like we did in ARPA?
We'll consider that as part of the contracts as well.
Okay. Do we do that now, or when we had?
We do have, so the way our CSGs are set up for grantees, when we get to that last payment, if they have not met a certain level of their target performance, we do not pay them fully for their last payment.
Okay. All right. Thank you.
Commissioner Griffin, League, then Townsend Ingram.
Thank you, Mr. Chairman. I clearly support the direction that you're going in, Mr. Manager. But I would remind the public and everyone here to first answer the question that was posed when there was an introduction to the balanced scorecard. The question is, who is the customer? Who ultimately, is it nonprofit or is it individuals? Who is the customer? The next question you ought to ask is, what are we trying to accomplish with that customer? And hopefully, the staff, Mr. Manager, and your team will recraft some of the outcome objectives that would answer that question. Who is the customer? and what are we trying to accomplish for that customer? And how do we know that we've accomplished this well for that customer? That's ultimately what my understanding of the balanced scorecard is, and SMART goals. I've waited for years to give this back to you guys. All this, the data. Every budget session I've asked you, give me the data. You've given me reams, 15 pounds of data. And guess what? I was fool enough to look at it. Looking at this from the performance management piece, I've even tagged it. Most of it, Michael, is processing and output, not outcomes. And the manager's trying to pull us back together to say, okay, who is the customer? What's the impact and the outcome for our customers through vendors, through third parties, fourth parties, direct services, or whatever? So the process is a good framework process. Proofs in the pudding, Michael, is how do you shape up those outcomes for your contracts? I'm on Human Service Chair. The next largest budget item is HHS. And when I've asked for contracts, the contracts are kind of open-ended, Dr. Campbell. It's more of processing. And what would be helpful is the ultimate impact for the customer. How well is the customer doing now because of taxpayer dollars? So we're trying to narrow our accountability focus to deal with the customer. As I said yesterday, I know it may have touched some people, I'm sick and tired of the presentations that say African Americans on the bottom. If we're applying the appropriate resources and community support, that should change over time, as opposed to, I'm not as old as my commissioner over here, but I am getting close to her, okay? And I think this would absolutely help us improve the outcome for the ultimate user, the customer, and also be responsive to the taxpayers' dollars. That's where I come from. So I support the process. Thank you, Mr. Chairman.
Thank you. Commissioner Leak.
Let me first say thank you for clarity and understanding. Does the public really understand our budgeting process and looking at grants that come to us? Do we ever peruse the budgets of those who are the recipients of our funds to see how those funds are spent? And they tell us they're taking care of it, but what do we have as a leverage to determine that they are? I said, now, when you tell me in nonprofit, somebody has a salary. So I want to know exactly how they operate with the funds they receive and what other agencies do they go to receive funds. Is it the federal government, the state government, then the local government? And who is the oldest group that received money from the county and has been as a county welfare recipient for 10 years or 20 years?
So Commissioner League, I can answer some of those questions. In terms of the CSG program, when they come in as grants, a couple of things that we ask for. We ask for them to provide us with their budget for the organization, and we have a template that they have to use that tells us where they're getting their other sources of funding. And this is something that we have our panels evaluate, because one thing that we typically don't want to do is to be stepping in while someone else is stepping out. We also ask for salaries of their board, and I believe their CEO as well, so that we have that information. And then when we make payments for CSG, so in addition to tracking their performance, we pay all of the grantees based off actuals. So every quarter, when they make an invoice to the county for what's been approved in their grant, they have to provide an expense report of what they spent that money on. In terms of who is the oldest, I don't know exactly who is the oldest. I know some of these organizations that I have seen when we look back, even going back to, early 2000s, there are some that have been on this list for a long time.
Commissioner Lee, regarding awareness, each year as part of the kickoff, We have an orientation session that is held in this room here. It is well attended. It is recorded and posted on the county's website as well. We partner with our PI department to market that orientation for the community's awareness.
Thank you. My last concern is knowing success of funds spent from the county to alleviate some of the problems. Some people have been there 10 years. And I have a real concern about board members sitting on boards that are the recipient of funds who share with them how to orchestrate the process in getting funds. Because they've said it to me.
Thank you.
Am I out of order?
No, the bell just rang, Commissioner, so that was your last thought, correct?
Yes, I
Thank
want
you.
a response to it, though. Not now, but sometime. And then they remove themselves from the board when we vote. But when they vote within the confines of the organization, they vote for it.
Okay. Thank you. Commissioner Townsend Ingram.
Thank you, Mr. Chair. So, again, I am the commissioner who has the privilege of having been on both sides. So I have been the manager of a grant that was received by an organization. So I have an understanding of the workings, and what I'm afraid of is that we are cutting off our, our nose to spite our face. If we pull, I agree with a lot of what Commissioner Griffin said. The framework is excellent. Yes, we need to have more accountability, but within that accountability, we also need to understand the lifeline that these funds are. Now, if there are additional programs and we're overlapping and we're using resources in the wrong way, then we need to know that too. And I think that Commissioner Griffin talked about that. But without providing ongoing technical assistance to these grantees, without providing them with a response back, do we tell them why they're being cut off or reduced or something like that? Or do we just cut them off at the knees and say, you didn't do it? You didn't get it done. Wait a minute, and one more thing. We're always supposed to be looking through the lens of equity. But if we take all of them and say, okay, you now have to compete, that is going to reduce our ability to impact equity, especially in the environment that we have right now. So I like the direction, but I think that it's going to, and it might take a couple of cycles for us to get this right, understanding that there are programs that we have, for instance, Medicist of Mecklenburg County. No, they should not have to depend only on our funding, but unfortunately, that's the world we live in right now. Unfortunately, things that used to be a sure thing are no longer a sure thing. So I really do think that we will be doing a disservice to our customers, as Commissioner Griffin said, if we don't look a little bit deeper, if we don't take a closer look at what we're cutting. And just at least having a tiered process for maybe weaning them off the system after a certain number of years, with the addition of the technical assistance. And that would mean that we're going to have to hire some subject matter experts to go in and evaluate and tell them what they're doing right and what they're doing wrong, so that when they do something wrong, it gets fixed so that they can continue to support those customers. Thank you.
All right, so I get the sense that there's a lot more questions or comments that could be lifted up with this discussion. So a couple things that I'm going to ask, Mr. Manager, if board members, if we could send your additional questions, comments, and feedback. Mr. Manager, would you like those to go directly to Adrian and copy you, or straight to you?
Yeah, that's fine. They can
Okay.
send them to Adrian and I.
So why don't we send those additional items and questions to Adrian? And also, Madam Clerk, when is our next budget policy meeting? Because, Mr. Manager, I want to make sure that, to your point about having a sense of urgency, if we could get this on the agenda for the next budget policy meeting and just go deeper. And those questions would be in, and Adrian and team would have time to at least evaluate and have a level of response so that we can make the meeting concise and then allow you to make some decisions. So is that fair?
That's fine. It's November 12th because the 11th is a holiday, it's Veterans Day. And as you think about your additional questions, I want you to be mindful of how we got here. You know, that the adopted budget include a tax rate increase and the elimination of community service.
That's right.
You don't see that happen often. And in terms of uncertainty, and the reason, again, why we're here now, the uncertainty continues. So that fiscal discipline is going to be very important as you continue to provide your questions and feedback pertaining to this problem.
Okay, that's fair. Let me give just some initial thoughts. So one, I do like, I think it's fair for us to move to a space of predictability. I think that makes sense. I think the other thing that really makes sense is this idea of not continuing to balloon the budget just for the sake of ballooning the budget. I do think that that is an imminent threat to us, and I think we have solved to that. I think the 2-year grant cycle term would be better for the nonprofits in and of themselves. I think it's more predictable for them. I think they would appreciate that. Where I do have concerns is that I want to make sure that there's a lot of times we're making certain decisions without getting feedback, and I think Commissioner Dunlap alluded to this somewhat, not his exact words, but I would like to see a level of feedback from our nonprofit partners with what we're proposing so that we can understand the unintended consequences on them to a degree. Also, when we talk about moving people off of the vendor list, I would like to see a ramp down portion of that. What happens is in the politics, small p politics is that we'll make a decision, we'll rip the Band-Aid off, we'll get 1,000 calls of things that we did not hear, understand, and from all these nonprofits, and then what happens is we got to come back to you, Mr. Manager, to say, hey, this one is, one that deserves to continue to have funding, and this one, has called us, and we're going to want you to reevaluate it. If we give them a time to ramp down, whether it's a 2-year ramp down, 3-year, but now you've got the ability to understand what's coming, you have the time frame, and then you can apply for other grants and really prepare and not just completely pull the rug out from underneath your organization. And at the same time, we don't continue to balloon the budget. So that would be a consideration that I'd like us to do. Also, this idea of multiple contracts, I think we should really take a look at that. If somebody has a contract in public health and they have a contract with DSS, is that, and it may be a need, but let's kind of look at that bucket as well for me. Feedback. And the only other thing that I would say, Commissioner Dunlap is exactly right. We did know about the $125,000 in contingency funding. We never really understood how to use it or how we could use that, but I would like to see that number at $500K for contingency funding for the board. And those are my comments there. And I don't know if you got any feedback.
I have one. Thank you for that feedback. The one item I'd like for you and the board to think about, if I followed you correctly, is incorporating the feedback from the partners, what that impact would be if they were to lose funding. And I'm a little concerned about that because, I've never heard any agency come forward and say, thank you for cutting my budget. And I say that loosely. Certainly, it'll be informative for the board to hear what that impact would be, but it's going to be coupled with advocacy. And sometimes the reason why we're cutting them is simply because we can't afford it. So I'd like to know how the board, if we formalize that as part of our process, how do you intend to utilize that information? Because certainly we respect what the need, the services they're going to provide to the community. It may move the dial further, but in terms of advocacy versus affordability, you know, that's where we find ourselves. So I'm a little concerned about incorporating,
That's fair,
as part of our process, allowing these partners to stand before you and articulate what the impact would be to their agents.
Let me clarify that, Commissioner. We're not going to go a second round. I'm sorry. I'm going to get my comments in real quick. Let me clarify where I'm coming from with feedback from nonprofits. Commissioner Dunlap raised this, right? Understanding going to a 2-year cycle, not necessarily advocating for funding or the purpose of funding, but just some of the technical aspects, moving to the 2-year funding. This would be the timeline as far as it would be a February piece, that sort of piece,
Shifter,
not the piece around whether the program is beneficial or not.
Got it.
So that's where I was coming from with that. So with that being said, why don't we do this? I know we're behind time. Why don't we go ahead and take our 15-minute break? Everybody relax. We'll come back and start with the presentations.
Thank you.
I want to know who's the oldest.
started, let me just give some ground rules so that we're all on the same page as how we're going to proceed. We're running a little bit behind schedule, but it's fine. Every commissioner, once again, has
45 minutes.
45 minutes allocated. Commissioners, you can use as much time as you want on your presentation. That's fine. What it does, though, it cuts down on the amount of time for questions. So colleagues, I just want us to be aware that those presentations, if they go 30 minutes, then it's going to cut down on the amount of time that we have. It's not, the clock won't be 3 minutes. So take as much time as you want. This is your time, and go from there. And up first is Commissioner Meyer.
Thank you, and welcome everybody. Welcome. I'm going to do what staff does. Welcome. Thank you, County Manager, Chair, Vice Chair, Commissioners, and staff. Seriously though, thank you, and thank you for this. I'm kind of excited about talking about my passion. First, I'm doing behavioral health. I'm presenting on mental health or behavioral health, many words for it. But I'm passionate about this, and I know some of you have heard this, but, and I won't tell his story because that is his story to tell. I will tell my side of the story. When my son was 17, we had some serious challenges, and it got to the point of desperation. And I think that if you're a parent, even if you have a 3-year-old who's skinned her knee, when your child hurts, you hurt. When your child is in trouble, you feel in trouble and you feel desperate and you want to do whatever you can to help that child. And I'm no different. And I'll never forget, I sat at the kitchen counter trying to figure out what I could do, what our resources were, where would I go, and I started with the county. I went on the county website. Honestly, at the time, it confused me. It made me a little more upset, and really all I could think about is what if I didn't have the resources for my child? What would happen? And that just led into a journey of finding out about mental health in the county, what I could do with somebody who had resources, who had insurance, which didn't cover everything, as you probably all know. Our insurance needs reform. But that is how I got to this point. And in 2020, when I was tapped to run for this seat, mental health was a big driver for me. So that's where I am now, and this is why I am here talking to you about behavioral health. First of all, I would love to thank Dr. Penn, number one, for being here. You will be called on. And she's been a great guide, and she really got me out of the weeds. I really started to get too detailed with things, and so she kind of brought me down to helping me narrow it down, so thank you. So right now, there's probably more awareness over mental health than ever before. Our children, the generation growing up now is dealing with things that we did not have to deal with, mass shootings in their own schools, social media causing depression and anxiety, and never before have we talked about it this much, and that's a good thing. Anxiety has always been there, depression's always been there, mental health issues have always been there, but we're talking about it more than ever before, and that's a good thing. And so before I talk about, well, first of all, my objective today is for you all to gain an understanding of behavioral health and the funding in North Carolina. We are, after all, a funding body, and we fund partly mental health. So I want to explain to you how we got here and gain an understanding of why we need to continue funding mental health in Mecklenburg County. So over the years, and I'm going to talk about how we got here first. You have to understand how you got here before you can move forward. I'm a history teacher. So I want to start with where we start with the beginning. And mental health used to be people were possessed with demons. They were taken out of society. They were put away, didn't want to think about it, didn't want to even talk about it. And as time moved on, we had heroes like Dorothea Dix in North Carolina. She started a hospital, Broughton Hospital in Western North Carolina, and those were asylums, mental health hospitals, and they were treated away from society. And that was a good thing until it wasn't a good thing. And as time went on, and this is not on the slide, but in 1963, President Kennedy suggested, or he proposed a landmark Community Mental Health Centers Act. It eventually passed, and by 1970, community health centers were serving 68% of North Carolinians seeking services in mental health. And so from the 1970s to 2000, North Carolina counties deliver behavioral health services and managed state and Medicaid funding. And warning, we're going to be talking a lot about Medicaid from here on out. So from 2001 to 2014, North Carolina passed the Mental Health Reform Act, and it was aiming to reduce the number of entities managing state and Medicaid funds and services. And so we gradually went away from, they were finding situations of fraud where the providers were committing fraud because they were being paid for their services and the services really weren't happening. So as time went on, after several years of controversy, we got to, we went from managing and doing it ourselves to hiring, contracting out Cardinal Innovations, if you guys remember. I know most of you do. And then from Cardinal, we shifted to Alliance Health, which is who we are with now. LMECIO, am I saying that correct? I'm terrible at the, say it again. Yes. The state began to move to managed care, which is where we are now, further broadening Medicaid funds disbursement. And so 5 insurance companies started administering Medicaid, including Blue Cross Blue Shield was one of them, and now Medicaid expansion took place here in North Carolina. So right now, Alliance is helping administer Medicaid and state funding for the uninsured and those who are underinsured for severe mental health services or behavioral health needs. They also administer federal block grant. We can get in the weeds. It's way more complicated than I ever thought. And so this deep dive for me has been quite enlightening. And I certainly am not the expert. So if you have questions about how we got to where we are, that is where I'm going to actually definitely have staff come help. So the takeaway of the history is I just want you to see in the past 25 years, North Carolina's management of behavioral health services and funding for low-income and underinsured residents has changed dramatically. With it, that role our role as counties across North Carolina has also changed. So currently, supporting residents access behavioral health services is technically a state and managed care, example, Alliance, responsibility only. But if that is the case, then why does the county invest so much money and why? So now I want to get into access to services in Mecklenburg County. Residents with private insurance or Medicare, 75% of county residents had private Medicare in 2023 or military insurance. And this is a 4% increase from 2015. And if you can see the chart, this is the annual out-of-pocket spending for insured individuals. For example, when I was looking for my own son, we had to use our own insurance. Insurance kicked in a little bit, but the majority, we had to spend out-of-pocket. Most people cannot do that. So as you see, for severe depression, $1,930 was the annual out-of-pocket. That's just an example of what our residents are having to spend. Now, residents with Medicaid insurance, 347,000 residents are enrolled. Out of that, with the Medicaid expansion, 84,832 residents were enrolled when we expanded Medicaid in North Carolina. Now, when or if, because we don't know what's going to happen with the federal cuts, if it happens the way we're being told it's going to happen, at least 84,832 people will be without insurance in North Carolina. I'm hoping that's not the case, but it could be more. It could be less. We don't know. There's just a big question mark right now. So something about Medicaid I think is interesting. There are no copays, but low reimbursement rates make serving people with Medicaid less attractive for clinicians. And I just want to repeat that. Physicians don't necessarily want to use Medicaid because it's slow to reimburse and they don't get reimbursed for the full amount. And I think that is extremely important for you to understand and disturbing as well, because that means people won't seek health access, they won't seek mental health help because they don't have the money to pay. So as of October 1st, the state cut reimbursement rates by 3 to 8% for many behavioral health services, placing greater strain on providers who accept Medicaid, which you just heard is not working. Residents with no insurance. Over 130,000 of us in Mecklenburg County have no insurance. That means they're not seeking help. They're not seeking mental health help. And if they do, they go to the emergency room. So limited access to care can use county-funded services, and if the behavioral needs get bad enough, then they could possibly access state-funded services through Alliance. And once again, which we keep hearing, undocumented persons cannot access care through Medicaid or state funding. I just want that out there because it is an untruth that's been told at the federal level. Medicaid does not cover undocumented individuals. So the takeaway of this, Medicaid, as cuts loom at the federal level, with the passage of that budget, which I won't use the name, less of our residents will be enrolled in health insurance and in a health insurance plan, whether it's Medicaid or even their own. The burden of treating the uninsured will fall on Mecklenburg County, including behavioral health access. And that's where we're moving forward here, is the burden is going to fall on Mecklenburg County. So how are we doing in Mecklenburg County? And I have to say, we support mental health in Mecklenburg County. I commend this county, I commend our staff for making it a priority. So, and I do definitely want to call out public health and who we contract out with, like say Camino or Charlotte Health Clinic. They provide mental health services too, and our money is also going to those. So in Mecklenburg County, the leading causes of death, suicide is number 9 in Mecklenburg County. Among our children, ages 15 to 24, it's the 3rd leading cause of death. Suicide is the 3rd leading cause of death among our children. From 25 to 44, suicide is also the leading cause of death. So, from ages 15 to 44 years old, suicide is the leading cause of death, is the 3rd leading cause of death. That is a sobering number. Youth behavioral health. I don't want to focus just on youth, but I definitely think it's worth giving you the numbers of our youth in Mecklenburg County. And I'm not going to read it for you, but substance abuse is a huge factor in our youth right now. If you look at, let's look at 2021, which was the last numbers that we could get. In Mecklenburg County, 17% of our youth had at least one alcoholic drink or more in the past 30 days, and they used marijuana 1 or more times in the past 30 days at 13%. And our psychological health, teens are ever attempted suicide or tried to kill themselves. In Mecklenburg County, 9% in 2021, and which is just below the state average at 10% and the national average. In Myers Park High School alone, in a span of 2 years, 4 of our kids in Myers Park High School committed suicide. 4. And I'll tell you, when I was growing up, I knew no one who committed suicide. In all my 4 years of high school, we didn't talk about mental health. It was never at the forefront of our discussion, and I never had to deal with a suicide. That could be different for you, but I can only think about myself. My own children saw suicide in school, and this really no surprise considering this generation is dealing with mass shootings, school shootings, social media, which has been known to cause depression and anxiety. This is something that we've never had to deal with, so it is kind of new. But I just wanted to bring that up about the youth. It's not all about youth, but we do need to take care of our children. And it being in the forefront, we became national news recently with the incident on the train, and this was an individual who had an undiagnosed mental health issue, or untreated mental health issue. And if you think, if we could have caught that person early on and treated that person early on when they were a youth, how different things would be right now. So just some trivia about substance abuse. Overdose deaths among Black and Hispanic residents in Mecklenburg County have increased by 20% since 2019, compared to a 15% increase among white residents. Fentanyl, contamination in cocaine, and counterfeit pills is a major contributing factor to these disparities. Our homeless population, I don't know the percentage. I wish I knew the percentage. Somebody might be able to help me. Are addicted to some form of substance. And if we could treat these people who want to be treated, things could be completely different. So general mental health in Mecklenburg County, how are we doing in Mecklenburg County? And as you can see, we're worsening. And I think some of us actually saw this slide maybe last year. So suicides at a rate per 100,000, our goal is 8.6, but as of 2023, it's 11.0. So 11 people per 100,000 people in our county have committed suicide. Youth suicide attempts, our goal is 185 per 100,000. This is just attempts. But as of 2023, we are at 205. We are moving up. This is one number you don't want to see move up. I won't go through all of them. You can see for yourself. But right now, our kids are not okay. Our residents are not okay. And we need to treat them the way they need to be treated. So the takeaway is, as the mental health of our residents is worsening, coupled with even more of our residents predicted to be uninsured, I want to repeat that. Coupled with even more of our residents predicted to be uninsured, Mecklenburg County is facing tough funding decisions around behavioral health. So what are we doing? How do we supplement? And this can get kind of, it does get kind of complicated, and I'll try to get through it. So these are our service types. This is what we're doing. As you can see on the left-hand side, the department, let's just say Child and Family and Adult Services. The service type is behavioral health contracts for community-based services. I'm thinking Care Ring, Charlotte Community Health, Camino, and that's at $13 million. So total, what we have funded is $23 million, but the actual total cost was $23,619, but we paid $23,479. And my point is, we're paying a lot in mental health. Our state is not paying like they used to. We are having to make up more than we have in the past. These are our county-funded programs. Again, I'm not going to go through all of them. Just to be clear, this is 2025. There are some on here that we don't fund right now. Hopefully, we'll go back to it, like, for example, Sid Kimmel. But these are some of the things that we are paying for now. We're also paying for the Steve Smith BHUC. We help contribute to the capital needs, but also it's a braided plan where Alliance contributes, we contribute, and Medicaid contributes. What Medicaid and Alliance does not cover, the county will kick in, and that's called gap funding. And so, correct me if I'm wrong, right now we have a contract with the BHUC for $750,000 a year, we will provide gap funding up to $750,000 a year. That's on top of what we paid for the capital needs. And so right now, I don't think we've gotten to $750,000. You're nodding. And so that's called a braided, that's braided funding, and it can get complicated, but that is what we're spending on just to BHUC alone. That is obviously a mental health urgent care. So it's imperative that the county continue to provide funding for behavioral health services, particularly for those who are underinsured and uninsured, allowing our most vulnerable residents access to critical prevention and intervention services. As we continue to support services for individuals, we are in turn supporting their families, we're in turn supporting their neighbors, and the community at large. When we help our residents, we're helping the community at large. It affects everybody. And as Chair Jarrell started yesterday, he said, if you don't have a place to live, what do you have? And I can argue that with mental health. I can argue that with green space. I can argue that with anything. If you don't have your mental health, what do you have? How can you make it through a day? If you have help, though, if you have resources, if our children know that they're cared for and they have help, they have support, we can make it through the day. And I believe that is it.
All right, thank you. Of course. Madam Clerk, we're going to try and set the timer at 2 minutes. Obviously, I'm going to give some flexibility, but that's just to keep us on track. So we'll start, so I'm asking colleagues to please be mindful. We'll start with Commissioner Townsend Ingram. We're going to work left and go right.
Thank you, Mr. Chair. The mic's not on.
Thank you. So I want to thank my colleague on the County Commission because Chair Jarrell knows that this is an issue that's really close to my heart, but I don't think that most people do. And I didn't know that you were as passionate about mental health care as you did. And I didn't choose this as my topic because I am too close to it. But I appreciate you providing all of the information that you provided because there's a lot of stuff that I didn't know with regard to your presentation. One thing a quote that I often use is contributed to Frederick Douglass is, it's better to build strong children than to fix a broken man. It's much easier to do that. So programs like Sid Kimmel and all of those others, again, applying the rules of, making sure that they're on target and servicing the people that they need to service, I absolutely think we have to invest more in, especially considering now Medicaid is at risk of going away. My son and your son, it sounds like, there's some similarities there that we probably could talk about and I could use your help with. My question is, how do we do the appropriate level of advocacy? Where do we put that advocacy? How do we work with the North Carolina General Assembly? Because everything is being pushed down to the states. So how do we appropriately advocate for particularly our kids and start there with the hopes of it, those services spreading out to additional people who need it? Because I can tell you there is also a cultural component because Black people are like prayed away. That's the first thing that's stated. And there's a stigma still that's attached to seeking help. So how do we advocate?
Thank you for that question. I think it's always a big question on how do we advocate, and I would love for Lizette maybe to suggest, if we're talking about the North Carolina General Assembly, I'm going to have to refer to Lizette Nimmons.
Well, so, is this on?
It is.
Okay. So, of course, I'll first refer you to our legislative agenda. So this is one of the high-level items. So what we do in general is, if there's something related to our legislative agenda that we see come through the General Assembly, we will advocate, we will support or oppose. I lean on my colleagues from HHS a lot, If I have questions, I go to them, and then we are able to formulate a response or make suggestions to members of our delegation on how we want to see them vote on a particular matter. So that's one way. And then there are always opportunities when we have our one-on-one meetings with members of delegation to share certain things. And again, through some of our annual events, you notice we have specific items that we'll discuss with them. So for me, that is the start of this advocacy. So.
And Dr. Penn, do you want to add anything? Sorry. Come share. Come up here. It's fine. Okay. This is not off my table.
It's not.
The walking up, it's not on me.
Reclaiming your time.
My
Is
fault,
that what you're doing?
Good morning. The only thing that I would add is that part of what I think, Commissioner Townsend Ingram, you hinted towards the issue of stigma within our community, and both within communities of color, but in general around mental health as well. But what I will share is that stigma is decreasing as we get down into the younger generations. But we are still in a state where youth who may be 15, 16, 17 years old cannot independently seek mental health services without parent permission. And so that is another thing that we need to think about from a legislative lens is, should we consider advocacy not just directly for mental health, but also for access to care for younger people? And how do younger people access care when they're saying, I'm depressed and I need this, but the parent is saying, not on my watch, pray it away. Yeah.
Let me move to Commissioner Leak.
Let me first say thank you, and I can empathize with you to some degree. Black boys have always been labeled as being unstable. When they started the school, I can recall my first year teaching, early teaching, Ritalin was given to black boys and not anybody else. First thing the teacher said, because you're up out of your seat and moving around, you got a problem. But this was never looked upon of other races. And I'm appalled at the number of young people committing suicide today versus years ago, because black folk didn't kill themselves. Well, the record did not show. And now we are getting that information, but we do not outnumber. When they closed the mental hospitals years ago, maybe 25 years ago, I used to take my psychology classes to Morganton to visit those facilities. And when we discovered there were many of our residents there in Morganton in those facilities, we stopped going. Parents did not want their children to be confronted with this behavior or what have you. So I'm saying to this community and to all of us, there's a little bit of weakness in all of us when it comes to mental capacity. You may be strong in one way and you may not be strong in another. So that's a major concern that we have to deal with. And when it comes to drugs and what have you, in my district, I go to a community, used to go every 2 weeks. I've become so concerned that I go every week. I can't do anything to impact that process. The bill stopped me. And I wish the bill could stop.
Finish your thought, Commissioner Lee.
Yes. I can't do anything to stop it. We've talked, we've met. We need to make sure that we come up with some form of action that's going to eradicate some of these problems. Parents, community. So I'm only saying to us, lobby with our legislators, lobby with us, to lobby with Washington and with Raleigh, to reestablish those institutions, those facilities. You drive along out here, we're just coming up here.
Commissioner. Commissioner.
I'll stop.
Thank you very much.
And I don't want to go off because you say I'm crazy.
So
Appreciate
I just want to say to that, thank you, Commissioner Leek. Advocating with the government is great. I think more education for parents is also necessary. I know that when the county did the 2 mental health forums in my district, they were well attended. People want to know. They want to hear what the resources are. They want to hear what the action is going to be. So I do appreciate that.
Commissioner Griffin.
Thank you. Thank you for your presentation. This is certainly an important topic, and I'm trying to figure out how we can improve the performance within Mecklenburg County. Certainly the big topics of ED visits, suicides, I mean, those things are sort of the big ones. But how do you sort of frame or categorize challenges with ADLs? And then what's the response in terms of ADLs? And that's something I'm struggling to try to get my arms around. But that's really important because that's also like a prelude to emergency rooms if you don't get your arms around the ADL piece. Can you help me with any examples or things we could do better around the ADLs so that we don't get to the emergency rooms and other situations?
In jail.
And jails, yeah.
In jail.
In jail.
And ADLs, just for everybody, is activities of daily living. And so I think, Commissioner Griffin, please correct me if I'm wrong, but what you're speaking to is folks being able to maintain full participation in a quality of life that we expect to have as individuals, but that we'd like to see our neighbors have as well. And the relationship between poor quality of life and poor mental health outcomes, is that fair to say? And so part of what we've started, well, and I think my division has done this for a long time, but as Commissioner Meyer's presentation shows, we contract for quite a few behavioral health services. And while due to matters of confidentiality and in some regard technology, we don't have yet a great capacity to measure outcomes directly related to behavioral health, what we do ask all of our vendors to provide us is information about social determinants of health and how folks who are participating in county-funded behavioral health services, how they're doing relative to social determinants of health, such as do they have access to transportation, do they have access, and are they participating in work or education activities, things like that. And so we are looking at that right now, but and you and I have had this conversation, but we are very interested in getting to a place where we can understand how folks' quality of life is different as a result of receiving behavioral health services that are county funded. So that is the horizon for us, and we'd like to see that tied into value-based care. How much do you get paid for your contract based on how folks are doing? We're not there yet, but that is what I'd like to see as a future state.
Thank you very much. My time's up.
All right.
Thank you. I'll talk quickly because I am sensitive to the next presentation that we want to get to. But I want to thank you for the presentation. I don't think we can spend enough time trying to explain to the community why the system is breaking down, where it's breaking down, because they need to understand that to know how to fix it. Because unfortunately, as you've said, Mecklenburg County does not have the financial bandwidth to do right by this issue for the full community. I say that as a former attorney for at-risk children. I had child clients who had multiple month-long stays in hospitals their bills were like well over $100,000 each time. I've had a family member in the state of Maryland who had multiple months-long stays that the government ultimately ended up picking up because, very few people at any level of income can afford what healthcare costs when it is catastrophic. And as a society, we need to put things in place that protect all of us from catastrophes of this sort, from health crises that are catastrophic, financially and otherwise. I just want to validate Commissioner Leek. I grew up in the 80s, and yes, Ritalin was prescribed to all kinds of kids who just may have had wiggles in their tushies, or, you know, needed to, maybe they were physical learners and needed to move around to learn. And that was a terrible disservice to all of our youth. And I also appreciate you saying that when you said there's a little bit of weakness in all of us, I remember someone once saying to me, none of us is as strong as we pretend to be. So it's just important to level set that so that we can just be more open to each other and support each other. So thank you for the time and the presentation.
Thank you, Commissioner Dunlap.
First of all, a little history that most of you probably don't know. We had Piedmont Behavioral Health, then the county had its own, and then we went to Cardinal. Some backstabbing went on, but we went to Cardinal, and then we end up with Alliance. And so part of that question is, I'm still confused as to what we pay versus what Alliance pay when it comes to treating mental health. Because when I look at this, and I don't know the number on the slide, it says 23,300.
23 million.
Million.
Oh, I thought I heard her say 23,000.
She said that, but it's
She
million.
did say 1,000. Okay, well, I'm repeating what she said rather than looking. Okay, all right.
23,301,000.
Thank you for that correction, because I'm like, that doesn't make sense to me. But, so, when we look at the new Taylor plan, where is the difference? Because the Taylor plan deals with those that are the worst of the worst. Are our mental health patients under the Taylor plan, or are they under?
Standard.
Yes, standard.
So there are criteria that designate one as being eligible for the tailored plan. So theoretically, a person would start, if a person has Medicaid, you're either going to be on the standard plan or the tailored plan. It is folks who have more severe behavioral health, substance use, and IDD needs, intellectual and developmental disability related needs, that would be assigned to the standard plan. So in meeting with, to the tailored plan. Meeting with the standard plan providers, one of the things that they've clarified is that after so many behavioral health related ER visits, or after so many inpatient stays, then one would be transferred to the tailored plan.
It's so complicated. It's just
So
complicated.
one final question, Mr. Chair. Given the fact that only county dollars can support immigrants who are not documented, how are we dealing with that? Because they have mental health issues too. And if we don't treat the issues, it becomes a problem for the entire community. So what are we doing to address that?
That's a good point.
Yeah. So part of what is covered under that $13 million figure that you see there, some of those contracts are specifically assigned to vendors who provide services to a large percentage of immigrants, undocumented or otherwise, within our community. And so we do have contracted services in place that meet those needs, or that are available to meet those needs on the behavioral health side. And I'm guessing Dr. Washington would say the same on the physical health side.
So one final comment. Please, it's all connected.
I'm sure it's connected for everybody, George.
No.
What other thing?
Okay, no, seriously. We have learned recently through the news how vendors get paid for services that they don't provide. We recently heard of a vendor that billed for $14 million, got $9 million, and you see what happened to the people that he was supposed to care for. The question is, what accountability measures do we put in place to ensure that the funds we pay for mental health services are actually used to improve a person's state of health?
Yes. And I'll give a short answer.
Please.
We do have a provider monitoring process that includes on-site visits with our mental health vendors, both looking at their documentation as well as collecting feedback from those who show up on their paperwork as receiving services.
Thank you. Commissioner Powell.
Thank you, Mr. Chair.
Yes, sir.
Thank you, no question.
Commissioner Rodriguez-McDowell.
So I want to ask a little teeny question of the manager, and that is, or whoever wants to answer. For the 23 million is, that's county funding, how much of that, is this part of the number that Adrian gives us when we talk about void of state funding?
Adrian.
Yeah, I believe we do include the behavioral health in it.
Okay, so if we had a state that was prioritizing mental health, we would assume that this 23 million would be paid through the state funding?
State, federal government, yes.
State and federal, okay. Thank you. Thank you for the presentation. I think it was fantastic, Laura.
Thank you.
Thank you for the presentation and the information. This is just for staff in general. I've got some questions. I don't want them answered now. I just want follow-up on this, and I'd like it to go to the whole board. First, I want to get a number on what our total contribution to Alliance is on a yearly basis. Also want to know how many people do they serve versus what we understand to be the community need. And again, when we talk about Alliance, they have a provider network, right? So there's independent practitioners and providers that are in their network. So when we're looking at that, however we have to slice and dice that, they have X number of providers, the capacity to serve in these particular categories is this, but we know that the need in the community is Y. From what we can anticipate. The other thing is, in your presentation, Commissioner, you referenced 130,000 uninsured or underinsured. I think that's a combination of both. What I'd like the board to get an understanding of is, I'll come back to you in 1 second, Commissioner. Deb, I got you. What I want to understand is this, and I want the board and the community to understand, when we talk about the uninsured, underinsured, 130,000, with our current funding partners who we fund, what's that capacity? Like how many, like CareRing to me is one of our biggest funders that move in that space. I want to know how many people they have the capacity to serve. I want to understand how we're reaching this 130. Do we have the people identified, or we're just, the math tells us that? And what we're doing to reach those underinsured, and how many additional partners do we really need to be able to cut into that number to the extent that we can? So I'm just really curious about capacity issues, the numbers, our reach. And so I just like I'll come to you in 1 second. Let me go to Leak first, and I'll come back to you. Just want us to get hopefully, and then if we have to go offline for me to clarify any of those points, I'm happy to do it.
I just want to say to that, those who are uninsured and underinsured are less likely to seek services. So it's hard to know who they are unless they come looking for help, whether it's physical health or mental health.
Okay. And that's fair, but there's got to be a way. No, thank you for that. Thank you for that. So let me give a minute to Commissioner Lee, and then I know Commissioner Griffin had something else as well.
I was listening to Mr. School Board Chairperson. We experienced a teacher and a principal who lost her life at South Mecklenburg High School due to the very thing we're talking about. And it has stayed with us. If we drive in any area where there's drug abuse, there's mental health. So this community is infested in the Black community. We're not responding to it. We're not helping it. We talk about it, but we're not doing anything about it. And that worries me that this community, meaning the city, have a responsibility, They're not. And I'm just awfully disturbed when we talk about mental health in our community. I'm seeing young women, young girls, 15, 16 years of age, who strung out on drugs. But that's not the real reason they're there. So we have some problems.
Thank you. Commissioner Griffin.
Yeah, mine's real quick, just to add to the chair. Last December, we gave Alliance Health $5 million without any strings. So we just add all the numbers together. Thank you.
Thank you for that. Thank you for that
Thank you.
presentation, Commissioner.
Thank you.
Thank you, Commissioner Myers. Good job.
And while, Commissioner Powell is up next. I was getting ready to come to you. I was looking at you. So.
I was going to say, Mr. Chairman, if we're behind, can we catch up in lunch? Because I don't want Commissioner Powell's time to be cut off.
No, her time is not going to be cut off based on that. We're going to we're going to move the lunch schedule. What I was trying to communicate earlier was that everyone would you still have your 45-minute block, but depending on how long the presentation is, dictates how long the length of questions are.
Okay.
That makes sense?
Yep.
All right.
This is your forward, this is your back.
But we're not cutting anybody.
Can't see those
Forward,
maps.
okay, I got
Just
it.
keep going.
All right, thank you.
Can't see those maps.
Even with my
I know
glasses.
you can.
I guess we're still in morning. Good morning.
Good morning.
Good
Good
morning.
afternoon.
So, I am Elaine Powell. I have two top priorities that I was thinking about presenting on. One of them is medic, and since we're going through the process of a survey, I was encouraged to do environmental stewardship, which is no problem for me. So one of my core values is environmental stewardship and environmental resilience. And I love that we're talking about the why of what is important to us, because we're so limited in our time talking to each other with the dinger. I didn't even know your story until today, Commissioner Meyer. And I think we need to know each other's stories. So yesterday when Rebecca was talking about, she had this slide where she was talking about roots and intent and integrity and how that's the base of like how we go forward into public service. I was thinking like, wow, I wonder if everyone in this room knows anything about my roots. And so I want to share some of that because, you hear Commissioner SRM, I never heard this phrase until we were elected, that politics is a blood sport. And I thought, what have I gotten myself into? And so there is distrust among some elected leaders. And where does that come from? And like people ask me all the time, what's it like to be elected? And I think, I'm really proud to serve on the Board of County Commissioners because every single person has a passion for serving the public and public good. And so I'm proud of that. Like I wouldn't want to be part of a group where you had to wonder like what people's intentions are. So this is a real awkward space for me to be in, and I want to thank Sean and LaShonda and Kim Henderson and people that make me feel comfortable in this space because I am an introvert, and this is a weird space for me. I'm a really good helper. I'm kind of quiet. I'm a really hard worker, and this is year number 36 of me advocating for environmental stewardship. And what is the why? What is the why? So I've been thinking deeply about this for weeks, about sharing this with you, because I've tried to make a difference for so long that maybe I have to climb the mountain a different way. And sharing the why is I think, part of that. So my first memory ever, and this relates to medic in a way, my first memory ever, like when they ask you what's your first memory, when I was a little girl, my sister flipped on the swing and her fingers all her fingers were stuck in the chain of the swings. And I wanted to help her so bad, but I didn't want to hurt her worse. And so I was running and screaming, trying to find somebody to help. And my mother said, "What is it?" And I said, "Her guts are coming out of her fingers." You know, I mean, she was really hurt. And so I tell you that because that is who I am. Like, when people are in an emergency, I want to help them. And so I went to work in healthcare. It's just who I am. Like, I am a caregiver. I went to work in healthcare, and what I learned really early on are so many things that affect people where the researchers suspect, but it was probably an environmental impact. There is so much suffering to human beings and to many other creatures, but there is so much suffering because of environmental impact. And so when I think of the first things that I saw, I had 3 specialty areas: high-risk pregnancy, women's health, and pediatrics. When we would deal with some of the patients, little bitty babies who weren't even a year old, with these horrible, terrible cancers that you didn't know where they came from, and then the researchers would come in trying to figure out a treatment for it, there was always a question of, is this genetic? What is the environmental impact? And so the reason I told you the story about my sister is because I wanted to help. So there's different ways to help, like how do you use your skills and talents to help? So I saw all of that, and it was troubling. Like, you carry it. You carry the suffering, like you want to help. And then one day, and these are things that are singed in your heart like forever. I think of this all the time. Because it's the why I'm never going to give up. I was walking down the hallway, and there was a code blue. So it was a 4-year-old black male who had walked outside on a code orange day, and he was being resuscitated. So he had such a severe asthma attack from walking outside, just walking out the door to the van, that he was clinically dead. And I don't want to give too many details. But the mother grabbed me, and when you see, and Medic knows, when you see these emergency circumstances, you don't know how people are going to act or what they're thinking. But when she grabbed me, she was shouting and screaming like, "Can you get me a camera?" And this is before cell phones. I was thinking, I have no idea why you want a camera, but I want to help you. Well, to summarize it, he was clinically dead. To resuscitate him took back then, a treatment that included part helium, part oxygen, to expand his lungs enough to get enough oxygen in to resuscitate him. It worked. He's still alive. But it was so terrifying. The intensivist on pediatrics had tears. These people are used to emergencies, but this is when you are talking, somebody was talking about the love you have for your children. I didn't have children yet, but I had the love for that human being of, wow, all he did was walk outside on a code orange day. And so watching the intensivist cry, talking to the pulmonologist, and a pulmonologist is lung doctor, talking to them, I said, we need to do something. Because I always feel that way, how can we help? The intensivist saved his life with the team. But I said to the pulmonologist, we have to do something. And at that time, I was young. I thought, well, we'll just go to city council. And I said to the doctor, and I think he's still alive, Dr. Carmine Dalto, I said, we have to do something about air quality. And he said, I said, can you come speak with me? And he said, you can do it. Like, I don't have time, but you can do it. And I was like, I could do it. You know, like, I'm an introvert. But I thought, yeah, I'm going to do it. I practiced and practiced. I was so nervous. I almost fainted. Like, I thought, I'm going to go talk to city council for 3 minutes. I'm going to get my 3 minutes. And now I look back on it thinking, like, I was so naive, believing that that 3 minutes was going to make a difference. Not knowing that I should come to the county, too, you know, like, to talk about it. But that was the beginning, my 3 minutes. And there happened to be people in the audience who, I guess they knew your 3 minutes might not matter. I believed it would matter. And they kind of like adopted me into like being an advocate for the tree canopy. And so now here I am in year number 36. I'm telling you all of this background, so how it started, me wanting to help, believing that's part of our responsibility in life. Like, you know, we all have responsibility to help each other. And so we go from air quality to like loss of tree canopy, and here I am 36 years later, and I'm going to start with my maps. I've done everything I can think of. This is like a new way of communicating today. I've done everything I can think of. I am, you know, like nobody could ever predict I would run for office. I never thought of this. Researchers call and they say, when did you think? Did you know when you were growing up you were going to be an elected leader? No, I had no idea. I kept working to make a difference to where I ended up here, because like it's the best way to make a difference is to be involved in the funding. So I just want to thank, I'm going to go through my slides and make sure I don't miss anything, I'm going to go old-fashioned. So I don't have a PowerPoint, but I have my index cards, and I have my real maps, and then and we'll show the digital maps coming up. There is data from when I started advocating till now, but it's not as reliable in GIS as starting in 2008. So we start in 2008, and I'm just going to walk. Maybe I'll carry it on. This is 2008, and I'll get the microphone so you can hear me. This is 2008 above us. And so I want to tell you the pink is the paved part of Mecklenburg County in 2008. The green part is tree canopy in 2008. In 2008 is the last time it was considered like a healthy tree canopy. So it's 50%, which affects air quality. When you work in air quality, you can't help but work with water quality, because natural resources are vital to life. So I start, because I'm in these meetings with air quality, I start learning all about the impervious. The pink on the map is impervious. That means it's paved. So in 2008, I don't know if you can see it, but 6% of the county is impervious. That's healthy. It's when you get over 10% that it becomes unhealthy. So 2008, I'm already involved at this point, but if we did better back then, we wouldn't be where we are. So this is 2008. In 2016, and you can see it up here, more pink, more impervious, less trees. Now, the tree canopy has gone from 50% to 48.9. This is significant because the city of Charlotte has a goal of 50% by 2050. But instead, it just keeps shrinking. And now the county has the pink impervious, and there is some non-pink impervious, the big highways, so we couldn't pink them out, but they're also impervious. Now we're at 12% and we're beyond 10, and it's become an issue. And we can't do more than the state sets as a minimum. This is 2024. This is last year. It's already worse than this. So I haven't shown this map to any person who wasn't shocked by it. The pink is paved. The tree canopy is shrinking. Where you see green now, there's already development. Now we're down to 47.5% tree canopy. Keep going down. And now we're up to 24% of Mecklenburg County is paved. So when Commissioner Leek says, why are we still growing? I think the same thing. Like, what are we doing? You know, like, smart growth hasn't been smart. And a lot of you know I was on the Park Commission for 9 years before I was elected. And I feel like I got put into a little bit of a box, which is okay, but I want to talk about that. Because I got put into this stereotype. Like, oh yeah, she loves parks. She is addicted to parks. She loves pathways. Earth girl. You bet I love parks and greenways and nature preserves and everything about them. They are for everyone. But it's way deeper than that. The National Association of Park and Rec has 3 pillars: health and wellness, equity, and environmental stewardship and resilience. It is the reason I served on the Park Commission. And I did my best to be balanced while my focus was on protecting natural resources. Through the process of serving all those years, I learned how much Park and Rec does to protect natural resources. Also learned a lot about how much stormwater does, and the great partnership that Park and Rec has with stormwater. You cannot separate health and wellness from the natural environment. They are completely intertwined. So I have some slides, and I want to talk about some of them because I can give you all kinds of statistics. We've done it. Since I've been elected, Chairman Dunlap was kind enough to make sure that when I asked for an environmental stewardship committee, he said, well, you have to bring it to the board. And we brought it to the board, and we've had a committee since 2019, unanimous. We established an environmental leadership action plan, a conservation and preservation framework, a farmland preservation framework, voluntary ag districts. We have done the work. I can show you all kinds of slides and numbers. There is nothing as powerful as that. I don't need to tell you anything else. Like, there should be sirens on this map of where we're headed for air quality and water quality without intentional, strategic thinking about land acquisition now. Like, now, what is left? There's not much left. So it's not like you can put it off. We have to figure out what we can get as quick as we can get it to protect it. It's the only way to protect it. So the pink is the #1 threat to water quality. Land protection, land acquisition, land protection is the best way to keep our streams clean and our drinking water safe. For all these decades, there has been by right development. By right. No urban growth boundaries, no impact fees. Because the state limits local control, the only way to protect this is public ownership. The bulk of this protection is done by strategic land acquisition, by Stormwater Services and Park and Recreation. So I'm going to go to my slides. This is one of our nature preserves. A lot of different things happen, cultural events, nature events. We have, the reason it's a nature preserve is we have an endangered grasshopper sparrow living there, but there's lots of different things that we have in Morrill Hill, and I just thought this was a pretty picture. But these are the spaces that everybody went to during COVID. These are mental health spaces in addition to everything else. This is a barred owl on one of our greenways who, it says, give an audible signal before passing. I just thought it was a cute, but you can't have a place for wildlife to live if you don't have natural green space. This is a southern leopard frog living on the Catawba River on one of our properties. These are my pictures. So, and how sad is that? That it's so rare to see. I mean, that we have developed almost every square inch of Mecklenburg County to where it's rare to see them, and they don't really have a place to live. So, in addition to all the good that Park and Rec does for air and water, it also protects wildlife habitat. Wildlife habitat matters. One of the most expensive, horrible public health problems in the world was because of the disappearance of a vulture in India. More than 500,000 people died just because the vulture disappeared and all the things that happened after that. So balance matters, circle of life matters. Oh, I have to go back to that one. So that was an injured raptor that was rehabbed at the Raptor Center, and you have to find a safe place to release them. The only safe place that they felt that they could release that one was at McDowell Nature Center. So that's where they released that one. Pathways are popular. This is an opening in Commissioner Meyer's district a couple years, 2018-ish, 2017 maybe, and Lee Jones is in there. But I just wanted to show, not only is it good for wildlife and water and air, but it's good for humans because there's the health and wellness and recreation component. They're very popular. I say the word biodiversity a lot. This is some biodiversity. This is also tree canopy. So you can see natural biodiversity, not a monoculture of crepe myrtles or non-native. This is a natural system. So I see a lot of people don't have any respect for natural systems, don't understand the importance, but it all works together. There are things about mushrooms we don't even know. So when we were in elementary school, people said the gallbladder had no function. People think mushrooms have no function. They do. We just don't know everything about them yet. But when you interrupt a forest to pave an industrial site, it's not like you can get it back by tree planting. You have ruined the natural system. This is happening all over the county. Actually, it's happening regionally. This is development, sedimentation going into our creeks and streams. This is my picture. These are when I get phone calls about this. It's cancer on the water. So the sedimentation is killing everything alive in the creek. And every stream, I think this is right, correct me if I'm wrong, every stream in Charlotte is impaired. And almost every stream in Mecklenburg County is impaired because of things like this. So those are, and I have hundreds more pictures if you want to see any more, but those are the ones that I just picked out because you can't send big email files to the county government site. It rejects the big emails. So before I call up my subject matter experts, I want to thank everyone for listening to understand. This is all for the public good. So while I've been stereotyped as a park lover, which I'm okay with, it's way more than that. I want everyone to be able to breathe comfortably I want everyone to be able to have clean water. And I really can't bear to see people suffer. I cannot give this presentation without thinking about Rusty Roselle. I carry his passion with me. This map, if somebody would put the 2024 map back on there, I would appreciate it. It was hard for us to look at together. So I just can't even give this presentation without thinking of him. And I don't want to get choked up. One more thing before I call my subject matter experts. The big takeaway, I think I've said it, strategic land acquisition is urgent. 2024 map should have sirens all around it. I thought about that. I thought about how could I do it so nobody would ever forget, like, how important this is. I even had weird dreams about it last night, where Rebecca and Taylor Swift were up here with me, and we had a song. We had a song about, like, this is serious. This is serious. This out of balanceness impacts health and wellness. It impacts humanity. It increases suffering. It's up to elected leaders to do better. And, you know, really, these are the elements of life. If we aren't adequately protecting our natural resources, what are we doing here? Because you can't do anything else without clean air and clean water. And I learned something this year from Mr. Levine about making sure that we communicate well with each other, because he never knew how important natives were until he asked for that tax incentive. And I learned about, and I want to say this right, Commissioner Altman, the Tikkun Olam, did I say it right? It's a Jewish concept, and I believe in it. I grew up very Catholic, but I believe in this concept, and it's about repairing the world. I believe that we have a responsibility to care for the environment through sustainability and stewardship to decrease suffering, and that is part of the Jewish philosophy. And it was just like one of the greatest moments of being elected, because when he understood the impact, he said, I wish I had known all along. And so I'm sharing all of this in case, like, I feel like I've shared it before, a lot of it before, but the vulnerability of, like, why this matters to me. I was standing in Levine Cancer Institute for a few hours. I was there for a few hours the other day. And same things were going through my head, all these cancers. Like, I am walking through the Levine Cancer Institute, surrounded by people being treated in all different phases of treatment. And there's cancer everywhere. Like, there's buildings of cancer treatments, floors with different kinds of cancer. Knowing that all of that is not genetic, that there has been some environmental impact, and that the research continues, but that it is upon us as elected leaders to do what we can to protect the environment. And Park and Rec and Stormwater are pretty much the guardians of that for Mecklenburg County. So that concludes my comments, I think, and I don't know how much time I have, but I would like to invite my subject matter experts up. So I have Chris Matthews in here somewhere, I think. Oh, okay, and I have Bert, if you would come up, and then I have Peter Cook. So if you guys would come up in case there's any questions for you.
Commissioner, we have 20 minutes left in your block. So
Yay, faster than I thought.
Yep.
So these are, come on up, come on up.
All right, so what we're going to do, we're going around table, but I'm starting to the right this time. So we're going to do 2 minutes, so we can stay within time. Commissioner Meyer.
Thank you for your truth. I appreciate your honesty, I really do, and your passion. First of all, thank you for highlighting that there is an intersection between green space and health and wellness. The city has the tree commission, the city has Tree Charlotte, correct? Is that's their goal, or is that our goal? And how do we work with the city? And I know I've asked this question, but I just don't see it as this is continuing to happen. What are we doing to stop it?
So I'll say my part, and then you guys can talk. What do you do when you don't have control over some things besides try to advocate to them, but it still keeps happening? And what do you do? Strategic land acquisition. So, I can't imagine they're going to meet the 50 by 50 in a natural way. And when you see it happening, people keep lowering the bar. Oh, well, maybe we'll have 45% by 50. But what do we do? It's good to have the partnership and talk to them, but how much control do we have? And the only control we really have is over the land we own. And the other part, people think we own so much land. So I asked GIS, So I asked GIS to put on the map what we own. So we put it in bars because it's protected because we own it. So if you come up at the lunch break and look at this map of what we own, it's not very much. And the bulk of what we own is around Mountain Island Lake, which is our drinking water. So we bought it to protect it. So really, what do you do when you can't control other things? You try to get control of it yourself. And so, Bert, would you like to speak to that?
Yes.
Okay.
Good morning. Yes, good morning. So we work with the city in several different ways. One is from a land acquisition standpoint. So if we have a target that maybe doesn't work for our needs, we share that with the city. They use some of their impact fees that they get, or I guess their mitigation fees, to acquire land for tree canopy protection. We work with Tree Charlotte to do tree canopy restoration or expansion on some of our properties where we don't have tree cover right now. And then we work with them throughout the rewriting of the Unified Development Ordinance. We got some progress in that, but nothing that's mandatory. It's incentive-based. And in the 2.5 years or so that we've had, since that time, we've only had, I think, 3 developers come and work to try to use that incentive. So because we don't have land development authority, when it comes to development, we're somewhat handcuffed in what we're able to do there.
Commissioner Rodriguez-McDowell.
Thank you, Mr. Chairman. Commissioner Powell, thank you. I've learned so much from you these 7 years that we've been together, and I am so grateful. When you said, I have a couple of questions. When you said we can't do more than the state says, I want to understand what you were referring to there. And also, I wanted to know, if you were queen of the world, what is the answer as far as, I know you said strategic land, acquiring land strategically, but do you think that higher density is the answer? And so if you can speak to those, that'd be great.
So I'm going to ask Chris Matthews to answer part of that, because density matters, because you don't want to gobble up every bit of green space. But I also have to say, it's so dense here already. When you talk about water capacity, I said it yesterday, the tiny little Catawba River can't handle much more. So density is good, if we were talking about a different county, but also it's way smarter to have density and go up than it is to.
That's what I meant, density meaning, I'm sorry, I should have said it better, you mean like going vertical with building as opposed to, less impervious?
Yes, and then if you're going to do, these things, do it on like less precious land, because there's not much left. But I want Chris to talk to that.
Which part of that question?
So how do we decide what land acquisition?
You may want to weigh in on this too.
Chris and Bert, whoever.
So good morning, Chris Matthews. One of the things that this board did a long time ago, before y'all were here, but the past Board of County Commissioners, was that they recognized that if we didn't protect our drinking water, that the water would get dirty and it would cost a lot of money to clean it up, and Charlotte Water would have to pass those costs on to all the residents in Mecklenburg County. And so what they did was they charged stormwater and park and rec and real estate to go and buy land around our drinking water supply, which is Mountain Island Lake. And that's one of the best things environmentally that this board has ever told us to do, because it's helped keep costs down for our residents. And so when we go out and buy land, we're not only looking for land for active park use, for ball fields and playgrounds. We're not only looking at it for greenways, but we're also looking at it to protect our water supply and to keep our air quality as high as it can be. I saw an article the other day, asthma is on a major increase here in Mecklenburg County. It's a big deal. So by being strategic and buying land along streams and creeks to help protect those from development, to help protect our drinking water supply, to do all these things to help keep our tree canopy in place, we're not only protecting the birds and the butterflies, but we're protecting people at the same time. And so that's really what Park and Rec does. We're looking for recreation for sure, but we're also interested in making sure that our residents are healthy, they have their mental health, and help to mitigate some of the impacts that we have from actually a quite sprawling community. Did you want to add anything else? Okay.
Commissioner Dunlap.
First of all, thank you for the presentation. Of course, I think you'd be crazy if they didn't know just how passionate you are about your subject matter. But I'll be one of the first to admit, I struggle when it comes to balancing your desire to acquire more land, and I see the need. I understand the need. I understand health and wellness. But if you've never been hungry, if you've never been homeless, it's hard to understand why the acquisition of some of this land is more important than feeding the bellies of homeless children. And so you have to strike a balance. I have not understood where that balance comes from, because I understand what it's like to be hungry. And so while the need is there, I struggle with balancing that passion against what so many people in this community need. I don't want to go play in the park if I'm hungry. The park won't feed me. So talk to me about how you balance that, because I struggle.
So the first thing that comes to mind is a lot of conversations that I've had with former Commissioner Rembert. And even listening to Chairman Jarrell. Who says that they're not all important priorities? We all agree. We all raised our hand to agree on the priorities that we decided on. And I'm really glad that Chairman Jarrell reviews them every meeting. We all agreed to that. They're all important. And how do you address them in balanced ways? Because you can't ignore that, but you can't ignore this. And you can't ignore mental health, and you can't ignore food security. And like you just, how do you balance it? And that is the tough part of our job. But this, Mecklenburg County is an economic engine for the state of North Carolina. If we don't address this, this will not be a desirable place to live. The quality of life will go down. People won't want to live here. And it, in my view, will be just like another kind of Baltimore. You know, people, or Atlanta, you know, who wants to move there anymore? So it's like Commissioner Jarrell says, it's a both and. Like, we have to balance it. So I'm not saying that this priority trumps every other priority. They all matter. And how do we do it in a balanced way? But this cannot be dismissed. You know, you can't say, oh, environmental steward, because it is dismissed throughout the nation. Like, people will say, we'll get to that later. I don't know how you're going to get to it later. Like, this is dangerous. That, the pink, you know, it's kind of hard to reverse. So I hope that answers your question.
Come to Commissioner Altman, please.
Thank you, Mr. Chairman. And I want to say, Commissioner Powell, the genuineness and authenticity that you bring to the role shines through so beautifully, even though you disclaim being an introvert. I want you to know that. And I want to say also that you have to be one of the most successful commissioners in memory in terms of your, with the support of the board, but your achievement, your record of achievement is pretty amazing. And I just want to take a moment to salute you. That's number one. This is a very important conversation. You know, I think our chairman emeritus has once, as he so often does, put his finger on the salient question, and it's one that you have always raised, which is balance. What is the proper balance? Because we do have a lot of alignment on our value set here. It's just, where is striking the right balance? So, you know, I look forward to our budget process where we look at the dollars that we're allocating to all these different essential things and continue to ask ourselves that hard question. I will be interested in Park and Recreation bringing forward an update. Maybe only I need it, but you know, when I remember there were real gaps in equity around park access, and that was 6 years ago when I was first hearing that. And later on, not today, I'll look forward to getting that understanding what improvements we've made in terms of literally achieving equity with access in park resources. And another thing I'll be interested in to inform the conversation, Mr. Manager, is how do other similarly sized communities, kind of like I was asking around homelessness, you know, I don't want to compare us to New York. I'll finish up real fast. We're not New York. But I also don't want to compare us to Mayberry. We don't, you know, and I don't want to compare us to communities that are stagnating, because I don't want us to stagnate and go backwards. So similarly sized communities that have our value set around environmental protection, I just want to understand where we are and what's best practice for a community this size. So thank you, Mr. Chairman.
Thank you. Commissioner Townsend Ingram.
Thank you, Mr. Chair. So most of my questions were answered. I do have two, though. One is public-private partnerships. Would that help or hurt? Because when I think of public, or private rather, I think of Duke Energy and how they are literally raping us. I probably shouldn't have said that out loud on camera.
It's out.
But is that a good thing, a bad thing, and is there room or strategy to involve them more?
So I'm going to ask whichever park professional wants to volunteer to answer that, because, you know, I don't have any awareness of any successful.
So we actually have a really good relationship with Duke Energy.
Sorry. Maybe not now.
From time to time, we work with them on protecting some of our endangered species that reside in their power line rights of way. We're looking at opportunities with them to increase pollinators, and which is an important keystone concept for keeping our nature safe. We've been working with them on some of the issues that have occurred for the flooding down along Riverside Drive below Mountain Island Lake. And so, Duke is certainly an organization that has a big impact on our environment just because of what they do. But we've been working really, really hard to kind of soften their approach, and they've been fairly receptive to working with us to mitigate some of the impacts that they've had.
How can we partner with the land acquisition part? What is the strategic plan on getting, and can that be employed, the public partnership part?
So I'll just make a quick comment, and then it looks like Nick wants to say something. One of the things that's a real challenge for Mecklenburg County is that when we're looking at protecting and having open space, which is parks and other stuff, we're the biggest entity in Mecklenburg County that owns land. The state has no state lands, and the federal government has no federal lands in Mecklenburg County. So it's really up to us. So if we're here to provide land for our residents and to give them a place to go, that's one of the primary reasons why we have such a focus on making sure that we're providing that infrastructure. Nick?
I think the manager's already highlighted some of the efforts that are being taken place with other municipal and governmental entities that are purchasing land, because at the end of the day, a large portion of the land that we need in gap areas and areas where we need to work on equity are owned by other entities. And so strengthening those relationships and having a better understanding of their development need for those properties can go a long way to not buying a property twice. Is probably the easiest way to put that.
And one more thing I want to say, Elaine, your presentation was amazing. I do understand the connection, one, because I come from West Virginia, and a lot of my family members died early ages from cancer-causing agents, and I know environmental factors. But what I would love to see, and this is not a question that can be answered today, but I would love to see, in addition to our priorities being read, just a reminder of the linkages among the priorities, because there's a method to our madness in the priorities that we chose, because they all feed into the other, and yours actually feeds into my presentation, a portion of it. So thank you so much.
Thank you. Commissioner Leek.
Let me say thank you for your presentation. Number one, I enjoy parks. I enjoy walking in the Greenway. And thank you for bringing that attention to this board. But when I think about the county, human services is always before me, human services. And that's why I stick closely with that. And the city has its responsibility, and are we holding the city accountable for its responsibility? People move here for the land, leaving New York, Chicago, wherever, and here we are putting more housing and not taking care of the infrastructure. So I have to stay with the human services aspect.
Well, thank you, Commissioner Leek. But health and wellness is totally connected to humans. I showed the wildlife habitat, but I also showed the people. And I have lots more pictures to show you, because everywhere I go, the people are there, sometimes it's so crowded, we get complaints about, oh, you need rules. You need to divide the Greenway. You need to, no e-bikes. These kids are crazy driving around on their e-bikes. And so they're for the people. They're for all the people, but they also provide wildlife habitat. And I don't know if you guys want to say anything. Okay. But thank you.
Thank you. Commissioner Griffin.
Commissioner Powell, you did just a phenomenal job in terms of your presentation. Your commitment, your dedication to your work is just phenomenal. Looking at your three maps, looking at the 2007-2008 map, and then looking at 24, and just looking at the concentration is just phenomenal. I mean, I haven't looked at these maps in the same way in terms of impervious impact in Mecklenburg County. So thank you for enlightening me. The other piece is when you go back to the 2007-2008 map, you see a lot of opportunities as relates to various things. And, you know, I'm going to talk about Regional Park in southwest Mecklenburg County before that disappears in terms of health and wellness, before it turns all pink too, because it's coming in that direction. The question I would have for you and your team, what I have been involved with is some discussions around something called stormwater, whatever the things are in the ground for stormwater. There is a question about jurisdiction, because in some parts of the county, there's city jurisdiction for stormwater in the county, and then there's county stormwater activities, and sometimes who regulates those? For example, there's a project in Southwest where the development potential runoff that you showed us in one of these, your very last picture, is going to head directly into Lake Wylie. There's no question about it. But the question is, who's responsible when there's both city stormwater jurisdiction and county stormwater jurisdiction in the same geography? Who takes the lead?
They work together, but I have that in my district, like right where Riverside and River Haven are with all the flooding. So I don't know if Ebenezer wants to answer that question.
It depends on the specific instance. We gather the information. Again, the city and the county work very closely to make sure that the compliance is achieved. We don't worry about jurisdictional boundaries. They work as a team, so we can kind of help you resolve that depending on the specific instance.
And it's the best city-county team I've ever seen. You know, like, they really work together. Did you guys want to add anything? Okay. All right.
I'm good.
Elaine, thanks for the presentation. Definitely enlightening. A couple things that I would want to say. Staff, I want to make a request for information. On my presentation yesterday, I showed where by 2050, we projected to have 1.7 million people here, and Commissioner Powell made a comment saying that Catawba River could not handle that. So what I'd like to understand, I'd like the board to understand this. At what point is growth a threat to the community? Like, what's the number of population with our current levels that we can handle? I want to understand what that number is. Is it 2.1 million people? Is it 2.5? 1.7? I don't know what that is. And so as we're moving forward, I think it's important for the community to understand if we don't address growth, are we addressing growth the right way?
No.
So I would like that, and if you need clarification on that, I'll follow up offline. The second thing is, whenever we have a critical issue in the community at a macro level, such as a COVID, we come together, city, county, school board, nonprofit, private sector, we all come together at a macro level. And when I think about balance, and I think about this equation of both and, I think at the micro level, so with the county, I would love to see Park and Rec not isolate or work in isolation outside of Ms. Hart with understanding the equation of housing, or someone from Dr. Washington's team with respect to health and human services. Like, I would love to be able to see, and I know we do collaborate, so I'm not saying, but every decision that we're making, so if it's land acquisition, which, in my opinion, doesn't make me right, we should be having the discussion around what does it mean with respect to housing, what does that mean, this acquisition mean with respect to the other components of the priority. And so having someone embedded from the team that's informing all of those discussions so that when you guys come to us with acquisition, it is a full-throated thing. It's almost like what you guys had done on the school board when you're saying, okay, we built these schools and these campuses, 20 acres with this intent to say, you know, you have the education center, you have the land, you have the activation of the park, and it's almost this mini community. So my point is, I think we should really have careful consideration in the way that we're approaching these issues moving forward. And I just don't believe that where we are as a community, as a state, as a country, the 20th century approach to the segmented, siloed approach to this department is responsible just for parks. This department is responsible for housing, this department. I really think that people should be embedded, informing, and coming to us with a comprehensive solution that is forward-thinking. So I'll leave it at that. Obviously, that's not board direction, that's one commissioner speaking. But at some point when it's appropriate, I would love for us to potentially examine if that's something that we would get consensus on the board to consider how we approach these issues. So I will leave it at that.
So I appreciate that because, you know, like you see, the problems have become so exaggerated as the population has grown. And, you know, the land that has been purchased in the past was purchased that way. That's how it's normally done throughout the nation. But now that we're in this explosive growth, if you want to talk to, you know, how we could do that in the future, you know, looking at like the parts that are really important to acquire for natural resources, but maybe expanding how much you bought to where you bought more land for housing near a park. You want to talk to that?
It's actually a really long answer, but I'll try and be super short with it. So many communities, when they have a park department, it's married up with the planning department. And in our community, planning is in the city and parks is in the county. And so we're continuing to strengthen our relationship with the planning department so that as they begin to approve development and work with developers, we're also at the table to say, hey, we need to also be able to provide green space and open space as part of the whole package, right? So one of the questions that came up in your meeting last week was there's 157 people that move into Mecklenburg County, Charlotte every day. And the question was, how many people are leaving? I did some research, and that's a net number. So there's 157 net people moving in, which accounts for folks that are also leaving. So as we try to provide human health services for those people, social services, we need to provide roads, we need to provide hospitals, we need to provide police stations, fire stations. We also, as the county, need to provide recreation and open space for those folks, right? And so it's really, to your point, we really need to make sure that we're talking amongst ourselves and working with each other, not only within the county, but also within each municipality to make sure that we're providing all of the things that all of the people need.
Go ahead. You jump in.
Yeah, I just want to say to the manager, and maybe, Tyrone, you could look it up if it's still available. We had an interlocal agreement signed by the school system, the city, and the county. And subsequently, as we were growing, we brought in the small towns because, you know, we weren't out there that far at that point. But that was something where there was a piece of paper commitment that we would sit at the table as we built schools. There were consideration for parks. That's why some parks are close to some of your older schools. If we could reinvent that, Mr. Chairman, that might begin to answer some of the questions about potential joint planning.
I know you referenced that yesterday as well. We'll have to take a look at that.
So Nick, I know you want.
Yeah, I was just going to add in that some of what you were talking about today exists informally. So again, when we are looking at acquisition, one of the first people that we have a conversation with is LaShonda about, does this make sense? And I'll be honest with you that it sounds like, again, only been here 9 months, but it sounds like that hasn't always been the conversation because they're so open to it. Because when you see these developments, a lot of times they're touting how close they are to greenways. They include it in their name, how close they are to a park. Likewise, having that same conversation about affordable housing, because it increases the quality of the affordable housing as well, I think is important.
So before we break for lunch, what I want to just say really quickly is this, is that what I just said, obviously there is not board consensus, so I want to be very clear with what I'm saying. I'm not making an ask, but my intent is to gain board consensus to have a potential discussion. So the manager and I have talked about a little more frequency of open dialogue, discussion among the board in a structured, informal way, I guess, is for lack of a better word. And this is one of those items that I would really like to tee up to take a deeper dive, only because, to your point, Nick, it is informal. And that can yield some results. But to Commissioner Griffin's point, to formalize, to me, is something different. And a formalization of a process or the way we do business may be something that we have to discuss moving towards. So I'm going to leave it there and say thank you, Commissioner Powell, and subject matter experts.
Yeah, I want to thank my subject matter experts because they are some of the best employees in the county. So thank you guys for being here. Thanks for your help. And I want to thank Sean again for like being such a great person to help with coordinating this. I want to thank GIS because they worked really hard on these maps. And so Scott Black, Andy Goretti, and Jai Wee, thanks to GIS. And I want to say the last thing, like, I will not back down on the urgency of this, and I won't back down on human health. I am here because of the suffering I have seen. It impacts human health. I wouldn't have spent 36 years just because I love parks. I spent 36 years because, like, other people are suffering. And it's up to elected leaders to make responsible choices for the future. Thank you.
Thank you, Commissioner Powell.
You can do 35 minutes and be back at 1, and we're reasonably back on time.
All right, so the proposal is 35 minutes to be back at 1 so we can get started. What do you?
Yep.
I object.
All right, let's just say 1 o'clock, we'll be back.
Everybody except George.
Everybody except George, right. back in so we can get started.
Well, where are they?
They're just out in the, they're
Did they
out in
leave
the
the
lobby.
Browns?
No, ma'am.
Did they get in the car and go home?
Just while they're waiting. No,
You're supposed
they
to have a bell, you're supposed to have a bell.
I'm supposed to have the bell, yeah.
That's fine.
I can't wait for commissioners to come back.
All right, I'm going to acclimate myself to
There you go, yep, get situated.
clicker thingy.
You're always a parent.
So the dot, and then the arrow, and then the,
Is to go forward, the small one is to go backward, the dot is your.
oh, I have a pointer.
Tap there.
A real red thingy.
I think
I'm not going to do that.
Yeah, I think it's green actually.
Oh, okay.
No, it is red.
Oh,
So yeah,
okay.
that's your pointer. But your-
I'm glad I'm sitting next to you.
Forward and back.
The chair.
Your
And it
parents
shows
taught
me
you how
right
to
here.
take care of
All
us.
right, everyone, we're going to get started. I hope everyone had a good lunch. And we will move on into a presentation by Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. Is this somebody's book? Elaine, did you leave this up? Or is this supposed to be up there?
For the presenter.
Oh, okay.
Yeah, she was.
I knew that.
Remember Bertha Lewis,
All right.
red hair.
Well, being the first person after lunch, hopefully y'all aren't going to be needing a nap, little snoozy time. I know sometimes the afternoon can be a little snooze factory. So anyways, wakey, wakey. Thank you for the great lunch. That was actually really good. And so I want to just thank the folks who are in charge of feeding us. Thank you all for this week, these last 2 days. So do I have to bend over, or does this like pick you up if you're standing up? Lift it up? Okay. Can you still hear me? Okay, cool. All right, so I think most people know pretty much that my background, I have a master's degree in counseling, and when I was in school, one of my favorite professors for my marriage and family class, one of the things that he used to say was that families are sacred things. And he would always remind us that when you begin to talk about someone's child, you have to take your shoes off, okay, because you're walking on sacred ground. And so I've never forgotten that. You know, as we begin to talk about the Child Fatality Review Team, I want us to sort of mentally take our shoes off, right? And to realize that we're really talking about not numbers, but individuals and loss. This represents loss. And so if there are 1.2 million people in Mecklenburg County, that means there are 1.2 million different stories. Each story is different, just like a fingerprint. Each and every person, one way or another, has a family story. Even if they're adopted or don't know their birth story, that becomes part of their story of origin. But one of our jobs is to be the Board of Social Services. So we wear that hat. And we have to make sure that we're doing the best for our children and our families. All of the topics that we're covering are related to one another. We've already kind of established that this is all kind of an ecosystem, right? So all of these things play a part in a child's life and in a family's life. So we all know that in the very best of circumstances, parenthood is not easy. We all know that babies do not come with an instruction manual. I am the mom of 3 adult children, and I can tell you, anybody in here who's a parent knows It's scary as hell to raise a child. So that is why Child Protective Services social workers are highly tuned to observing families, right? And this slide is talking about one of the top problems, one of the top reasons for preventable deaths of children and babies, right? Unsafe sleep is one of the biggest causes of preventable deaths for our infants. And so our social workers are trained to teach people about that. And from the very beginning, or as they become involved somehow with Child Protective Services. So I want you guys to know that, you know, the goal of the Child Fatality Review Team is to eliminate preventable deaths and reduce all child deaths. So I want to give you a sense of who is in the room in these Child Fatality Review Team meetings. CMPD, Medic, the Coroner's Office, CMS, Public Health, of course, DSS, YFS, there are doctors and nurses. It's a room full of literally amazing people. And each case, each child fatality case is reviewed one by one in as much detail as possible. And collaboration is given around what could be learned, what could be done differently, was something missed, and all of the folks in the room contribute to the conversation. So this is a list of the types of cases that are reviewed, which include, some of them are unintentional injuries, violence, motor vehicle accidents, suicide, deaths related to maltreatment, or child deaths involving a child or a child's family who is reported to or known to Child Protective Services. This side explains that the CFPPT is breaking into two teams. So it's been called the CFPPT for a long time, and now due to some new legislation that became effective on July 1st, it's breaking into two teams. One is the Child Fatality Review, which is led by Cotraine Penn. Did she leave? She gone. And Rosaria Trishalo. And so I wish that they were both here, but raise your hand, Rosaria. Okay, so they're the two chairs of that team. And so that team reviews all the cases, and then that team will then share the recommendations with the Community Action Team. And that is currently being led by Corey Goldstein of Safe Alliance. And it's made up of some partner agencies that are charged with moving the recommendations into action. So I'm going to be attending both of these, the Child Fatality Review and the Community Action Team. All right, so this graph shows the child death rates from 2019 to 2023 that are 0 to 17 in Mecklenburg County versus the whole state of North Carolina. Okay, so our rate is slightly below the state rate, so we're the blue line. Here are the number of deaths broken out by leading causes. You can see that perinatal conditions are the top cause, 31.6%, which perinatal means the time, usually a number of weeks immediately before and after birth. Okay, so that's the top line there. Here are the deaths by age groups. Over 2/3, 69% of deaths occur between ages 1 to 4 and 15 to 17. So among the leading causes of death in the 15 to 17 age group are homicide, suicide, and unintentional injuries. Here's the breakdown by race and ethnicity. Black children make up over half, 57%, of all deaths in 2022, even though they only make up 32% of the total child population. So the biggest focus of the work for the team is around preventable deaths and what the county and its partners can do to reduce these deaths. This slide has a staggering statement right there. 208 child deaths could have been prevented from 2018 to 2022. 208 preventable deaths. Preventable deaths make up 33% of all child deaths in 2022. So here's the map, our famous map, which shows where by zip code the preventable deaths occurred from 2019 to 2023. So the darker the color, the higher the number of deaths. Remember, preventable deaths include intentional, unintentional, and child abuse fatalities. This tragic slide spells out the types of DSS-involved fatalities that were reviewed by year. It is important to note that DSS was involved in that child's life prior to their death, and that not all occurred due to child abuse, maltreatment, or neglect, but nonetheless, these child were folks interacting with DSS. This shows the children in Mecklenburg County's custody. In HHS committee last week, I believe it was, we heard a really encouraging report. Denise Steele Campbell, are you still here? There she is. She really gave us a great report about the number of children in custody coming down in 2025. She also highlighted the retention rates for social workers, and I found it really, really encouraging. They are really strengthening the team and showing progress that I've just been, wishing for a number of years, and I'm just so pleased that it looks like it's happening. So thank you for that. And that last slide is pretty. When I look at this, my head spins, and so if we have questions around this, Rosie is going to come up here. She's going to stand right here, and she's going to answer the questions. Or Denise, sorry. I always call her Danielle Steele, like the author, Danielle Steele. It's Denise Steele. Anyway, so if we have questions about that, we will have the subject matter experts, because that just really blows my mind. Okay, so this slide shows the many partner agencies and organizations that collaborate in this space. So you'll recognize many of our nonprofit friends here. And so these folks are all doing amazing work. I'm just giving you a minute to kind of look at some of the names there. So this slide is highlighting some of the actions that the CFPPT has taken, including distributing gun locks, safe sleep-related materials, and creation of a child abuse maltreatment prevention strategic plan in partnership with UNCC, and y'all remember that we funded that a few years back. Here's a little bit more about the strategic plan here. The priority areas for prevention include positive parenting, parental mental health, parental substance abuse, domestic violence. And here, this speaks to the triple P, which is the positive parenting, promoting positive parenting, triple P. This is an evidence-based parenting program that helps children by providing interventions for parents who need tips and strategies to prevent child abuse and neglect. So these are programs addressing parental mental health. You'll recognize some of these programs, such as RECAST, which is a grant-funded program that brings evidence-based trauma-informed practices, improving access to high-quality mental health services and support to curb community violence. Parental substance abuse prevention. This is a selection of some of the things. It's not all inclusive of programs that are funded in part by Mecklenburg County opioid settlement funding. Programs for domestic violence prevention. These are programs that work to address domestic violence prevention. And I'll just point out here that Housing for Good is a rapid rehousing program for families fleeing domestic violence. Housing for Good is part of our rental subsidy funding. So this slide highlights some of the ways that a social worker can play a critical role in the promotion of firearm safety. So one of the things I asked Rosie to do was to, let's talk about what a day in the life of one of these social workers might do. And so that's why we wanted to highlight at the beginning, they might teach about safe sleep habits. They might also teach about gun safety. So I just wanted to conclude with a little personal story in that when I was in second grade, my family moved literally across the country from New York to New Mexico to move in with a relative. And mainly it was because my parents didn't feel equipped as parents. And I remember it being strange and uncomfortable and full of tension. But in hindsight, I really respect my parents for doing that. They really felt out of their depth and they sought help. Because as we've established, parenting is hard. And it is a long-term thing. It's daily, it's yearly, and sometimes tragedy comes home. But I believe that the trajectory of a life can be radically changed through meaningful, skilled, caring connection. So this is what's behind my deep respect for the people who do the work of counseling, social work, and mental health in general. In Mecklenburg County, parents can seek and receive help. This is why I have really loved serving, and this chokes me up. Serving on this team has just, it's been one of the highlights for me over the past 7 years, even though all I really do is a lot of listening and very little speaking. I truly love being with the social workers, the counselors, and the administrators who are really trying to reach people one by one on a huge scale to save lives and to improve trajectories. And to me, there's just no greater calling. They are literally heroes, and I think we need to keep lifting them up, raising their wages, and valuing what they do for our community. So my subject matter experts, Rosaria and Chantel Lowry, they're from public health, and they are really doing amazing work. And so I wanted to say thank you to them now, and to all of their colleagues that serve in this way. So I'm super proud of the county and how we work in this space. So with that, I don't know how long that was, but.
You're good.
Okay.
Good time.
All right.
So 3 minutes, Madam Clerk. We'll start with Commissioner Griffin. We'll go to Commissioner Powell, then Commissioner Altman.
I'm looking at my notes, Mr. Chairman.
You want me to go?
No, I'm good.
Don't ask me any data questions,
Yeah,
Griffin. Come on now. Give me a break up here. Give me the touchy-feely questions. I'm not good at the data questions.
I think your presentation is absolutely phenomenal. Certainly, this is so critically important because you're talking about children. And clearly, it's all of our responsibility to make sure that all of our babies grow up healthy. And but I was looking at, because I was just curious, it's not really data, just some numbers on your slides. On one slide, you got child deaths 0 to 17, Mecklenburg County versus North Carolina, 2019 to 2023. And it says 59.1 for Mecklenburg County. And then the slide right after that is all child deaths 0 to 17. And you got like 155, and I was just kind of curious in terms of the numbers. But I thought the last slide, not the last slide, but a slide that has the number of DSS involved fatalities no matter which one of those numbers you look at, whether it's a 155 or 59, there were only 9 DSS-involved families. So obviously, where prevention and intervention is going on, it appears to be working, whatever number it is, whether it's 59 deaths or 155 deaths. And that is a good thing in terms of data. But I was just wondering which one of those numbers was, what's the difference in the interpretation of those numbers? One is 59 and one is 155, but.
Something that trips me up sometimes on these is the death rate versus the actual numbers. I don't know if that's it, because right now my brain's like flipping around in circles and I don't really know.
But the numbers say to me.
But Rosie might know.
That's it. That is it. The 59.1 is the rate.
Oh.
Is the rate?
Yep.
Oh, okay.
155
Okay.
is the number.
See, I knew that. Okay.
And the
It's the rate.
155 is the actual number. Still, that is significant because, it just really, the difference is really significant. And I think a lot of it goes to what we're trying to do in terms of prevention. Last question before my 3 minutes is up. There is a group that recommends or identifies gaps and deficiencies somewhere on these charts. Yeah, it says identify systems gaps and deficiencies. Can somebody speak to that a little bit in terms of what are the gaps and deficiencies in that process by the Child Fatality Review Team?
Rosie's going to answer that.
Rosie?
Commissioner, is this on? Can everyone hear me all right?
Yep.
So when we refer to identifying gaps and deficiencies, part of the review process, when we meet as a team, involves discussing, with respect to the events of the death, were there certain protocols, processes within our different partnering agencies that were present or involved with the death that could have been improved upon? For example, with medic, a lot we talk about response times and different protocols. If it is a death related to a child suicide, were there processes that could have been improved with our partners at CMS to have helped identify some of the challenges that child was going through and connect them to resources? So that's what we mean by identifying gaps and kind of improving systems in that way.
Yeah, I think that my time's up, but I think that's important, Mr. Manager, as we look at the balanced scorecard, in particular relates to SMART goals in terms of who's the customer, and then what were our expectations in terms of that intervention. So thank you, Mr. Chairman.
Thank you.
And before we go to the next person, I just want to say that, when we talk about that, like what Rosie just described, I want you guys to know that the room that this takes place in is like I said earlier, it feels to me such a respectful place where these things are not talked about in any kind of light way. They're talked about in very serious and somber terms, and everybody is extremely respectful.
Commissioner Powell.
Thank you. It is emotional because we're talking about children. I have like you were listing, and I don't even know what slide number it was, why social services would get involved. And one of them was, I think it said car injury, vehicle injury. And so I think it's probably better for one of your subject matter experts to answer, like, in all these different instances, how are they notified? Like if a child has a head injury, are they notified by medic, hospital? How are they notified for different kinds of injuries?
I don't think that was a DSS necessarily involvement, if it was just a motor vehicle accident, but it could be that someone who was involved with DSS happened to be in a motor vehicle accident, but you wouldn't call DSS because of a motor vehicle accident. Is that right?
Correct.
Okay. Does that make sense?
It does. And so if you could just tell me, how are you notified? Like, if somebody's, like, does Medic call you sometimes? Is it the hospital? Who calls you guys to say, look at this injured child?
So what would happen is we wouldn't get a call for any and all motor vehicle accidents that involve children. What could happen is if a child is in the hospital and the parents aren't meeting the children's needs, then we would be contacted by the hospital to say that we have this child that is in need of medical attention. The parents are not following through with that, and therefore we need DSS intervention to ensure that this child's needs are being met. That would classify under medical neglect for us.
Okay, thanks.
So, Commissioner Powell, are you asking, like, if it seems like the child was in an unsafe, they were in an accident, but it was obvious maybe they weren't seatbelted or in their car seat or something like that, and would they notify DSS in that kind of case?
Yeah, like I heard somebody reversed over their child with their car, and DSS was involved, and I thought, well, who notified them? Was it the police? Was it Medic? Like I just was trying to understand how it's done.
And it could very well be either of those, depending on the situations. We get calls from police, from the hospital. Those are some of our highest reporter sources.
Well, thank you for shining the light on this, because it is such important work. And in a world that's so disconnected, everybody wants to be on their computer and remote, like these human touch points matter. So thank you.
Commissioner Altman, then Commissioner Leek, and then Commissioner Dunlap.
Commissioner Rodriguez McDowell, I really appreciate your amazing presentation. I think you did a phenomenal job. I think in the 7 years or 6 years that I've been here, I don't know that we've gotten this level of detail and insight, and it was, you could hear a pin drop in here. I appeared before the Child Fatality Task Force once as an attorney at the Council for Children's Rights, and when she says it's respectful and somber, that is the understatement of the year. It is, a space where the most horrible tragedies to the smallest amongst us, one after another. It's really absolutely heartbreaking. So I join you in lifting up the people who come and do that work, and I thank you for your service there.
Thank you.
Commissioner Leek.
Thank you, sir. The most valuable people we have are children, our infants who become adults. And in between that birth and death, all things take place. And it bothers me when I know that and come in contact with young children who've been abused, who've been neglected. There's more than one way to neglect a child. It's not by just walking away. We neglect our children by not even communicating with them or having an opportunity. And my experience with, Sunday school, Bible school, all of these things play a role in developing our children. And we neglect the very people that will be our future, who will, I always say, give us a cool glass of water. We can't get it ourselves. And I'm sorry we have to have in this report about fatalities that today we're seeing more children being killed than we've ever seen in the home, shooting, violence, all domestic violence, sexual harassment of children, taking advantage of them. And you see a lot of teachers, a lot of preachers, a lot of dignity-caring people within the confines of our community take advantage of the weakest of weak, and that's our babies. And I listen to the young people who come to us to talk about domestic violence. There's more than one way. Bullying is a form of domestic violence, even if the child is not, the wife is, or the maid is. And I want to thank you for this being, I guess, our last report, that lends toward the ear of the most valuable possessions that we can have is the birth of a child. When many people want children and cannot. And it's a role that we play as a community, not to introduce them to those things that they should not have. And many of us are weak, and we do it. Alcohol, drugs, prostitution of young children. I never will forget a social worker came to my sociology class and spoke about a father had taken advantage of a 4-month-old baby girl who had to have 4 or 5 surgeries to recorrect what the father had imposed upon this child. So there's a lot going on in our community, and we need to be more aware of it and be careful about who we put our children with. I say to people, be careful who you allow to deal with your babies and your children. It's a danger. So thank you. Was that my bill to stop?
Yes, ma'am. Thank you.
STOP mean what? What does that mean?
Stop.
Thank you.
Commissioner Dunlap.
Thank you, Mr. Chair. First of all, that was a very good presentation on what's going on, and I'm sort of like my colleague here. It's the first time it kind of really out there so that you would understand it. I would like to know more about what's happening to that 399 kids who are in custody. I'd also like a breakdown of the 56% of African-American children deaths. I'd be curious to know how many of those were by gun. The recommendations, again, because I think the focus ought to be on preventing those 200 and some deaths that occur. And then lastly, whatever Mecklenburg County is doing, you should be commended, because this is one of the first time I've looked at a chart that says that Mecklenburg County is below what the state is doing on anything. And so you guys ought to be commended for that, really.
How many of them are here?
So if you want to start with this chart, the 399 children, we'll have Denise and Rosie talk to that.
So currently, we have, as the slide shares, 399 children who are in the custody of the department. Our goal for our children who are in custody is for them to seek permanence. We always try and work with families to reunify our children with the biological parent if that is in their best interest. We also do a really good job in identifying if the parents are unable to meet the needs of their children and to ensure their safety, then we will identify kin. If we cannot place with the biological parents, we want our children to be placed with their kin. So this represents a total number of children who are involved with us through various maltreatment issues. It could be abuse, neglect, or dependency. So again, our goal is to reunify our children as quickly as possible with a family member, with a custodian or a guardian or a permanent plan of adoption. I do want to share, just have to highlight the work that we've done over the last few years. The number of kids that we have in custody now is the lowest that we've had in years. We've had as many as 1,000 kids in our custody, and we are now at 399. And that's just a result of the work that the social workers are doing to ensure that our children and families are safe and getting the resources they need to be successful.
Thank you. That breakdown of that 56% of deaths,
Thank you for your question, Commissioner.
right there.
So while I can't speak to an exact breakdown of that 56.6% today, I will provide sort of a teaser for this time next year in that part of the legislation that was just passed, effective as of July 1, means that as part of our new process around child fatality review, our team will be presenting to the board with sort of our new process and our data each year. So come next year in our report, we'll be able to do further analytic breakdowns of our data, sort of breaking this down even further by category of death. So for example, violent deaths, as well as suicides, drownings, motor vehicle crashes. So we'll have sort of a closer look at some of that for you. I want to speak and just highlight again some of the wonderful programs that we have that are working on all of these deaths, whether that be our Office of Violence Prevention, that is working on, again, targeting some of those violent deaths and reducing community violence. We have our Prenatal to 5 program and all of our sort of case management programs that target those perinatal conditions and deaths related to our #1 cause of death in that way, as well as a lot of our injury prevention work that we do with a number of the partners that Commissioner Rodriguez-McDowell highlighted that are part of that community action team work. So again, happy to provide additional breakdown as this group continues to work.
Thank you. Commissioner Meyer.
Oh, thank you. Thank you for your presentation. And I'll start with touchy-feely stuff. Just thank you for sharing the experience you're having with the commission you're serving on, because we don't all hear about what we're serving on. And this was really interesting, and the numbers are absolutely sobering. Something that I also haven't seen, so thank you. But I do have a question about that one Child Protective Services chart. I don't know the number. It doesn't
Okay.
have.
What was on the chart?
It's the one, children in custody by age, Child Protective
Oh,
Services
okay.
needed. The Child Protective Services needed at 770, is that foster care? And then they come back. Tell me, how does that relate to the 399?
So with every case that we're involved in through investigations, a case decision is made at the end of the investigation. And what you have here is a breakdown of the case decisions. So when we have a case that has the Child Protective Services needed, what that means is that we have investigated a family and we have found that we are not closing our case because they're in need of additional services. We have not removed the child from the home. It doesn't rise to the level where the child is unsafe, but we have found that the family is in need of additional services. It could be parenting classes, it could be domestic violence services, but it's enough where we are continuing to work with the family to ensure that they are participating in services while at the same time ensuring the safety of their child. So not in custody, still in the home with the parent.
Okay, all right, thank you, I appreciate that. And I also just want to highlight that I really there's a lot of focus on parental well-being and how important that is.
Yeah.
Because, when people are desperate, they do desperate things and things that, they don't mean, and it's just so important to help the well-being of our parents who, again, our kids don't come with manuals, so, but thank you, I appreciate it.
Yeah, if parents aren't okay, then kids are
are not okay.
definitely not okay. So, well, I think with that, oh, right. Sorry, Mr. Chairman. I didn't-
No, you're fine.
I'm not forgetting you.
No, you're fine. I just wanted to say a couple of things. One, thank you for the presentation. It was really enlightening. I echo the sentiments that everyone has raised. A couple of things I do want to lift up, and one of my biggest takeaways is going to be the number 208 from this presentation. That was the preventable deaths.
Mm-hmm.
And when I think about that, think about the loss in terms of human resource, human capital and resource in that way. So what did the community lose? What did the country lose? What did the world lose as it relates to preventable deaths?
Yeah.
And so that sort of hit me like a ton of bricks. The second thing is, sometimes in staff, I want our staff to really understand when we shout you guys out and when we're lifting you guys up in ways, these are ways that the board can do it when we're calling out, and it's not performative. It's something that this board recognizes as we travel, as we get to talk to our colleagues that are from other places. And when I look at Child Protective Services or our program managers or our caseworkers, people that are like leaning in the community every day and helping people and meeting people sometimes at their worst, under the worst circumstances that we could ever imagine. And that also hit me from the presentation, not directly, but indirectly, because I'm constantly concerned about the work that we do in this human services space and how our staff and our team is adjusting to the mental health components that Commissioner Meyer raised earlier, right? And so what do we do to provide resources for our own that have to deal with this every day? Like, we get to go to it monthly or hear about it in committee, but we're not doing it every day. What's the toll on their families when you have to take that home with you? And so I only lift those things up to say, on behalf of the board, thank you to all of our staff, all of our team, no matter where you are, to know that we are thinking about you. We appreciate, and this community appreciates that level of commitment, because as we saw when we went through the income breakdowns, you can't really put a price tag on what you do. So I did not want this moment to pass without lifting that up in that particular way, and thank you, Commissioner.
Yes, thank you. It's one thing that I think I heard over and over again was surprise. And, I think maybe we should be looking for ways to share out from our committees or where we liaison or something like that to each other.
That's a good point. I got a mental note when she said that, because you're right. We don't hear from our committees. And I've heard Commissioner Leek say that over the years as well. So thank you.
All right. Thank you, everyone.
All right.
And Commissioner Leek, I'm not the last one.
All right, Commissioner Townsend Ingram, you are up, ma'am. That's what I'm going to take away of that.
Was it in? Yeah, there's a link in there. It should open.
To instruct, I'll go over and tell them that when it's time, click the link.
That's a good point.
Okay, this is forward.
Yep.
This is your forward,
Okay.
that's your backwards. If you need a point, that's your neutral.
All right, thanks.
They're very hard to teach.
Did you bring them?
I brought them to share.
So I'm really excited about this opportunity. I'm not excited about the fact that I had to go last, but it actually gave me an opportunity. I learned so much from everybody's presentation that I literally went home and kind of tweaked my own slides a little bit for my presentation. And I just want to say, in connection with the last presentation, and what has been said about mental state and everybody is not as strong as they think, I know my lane. The topics that both Commissioner Meyer and Commissioner Rodriguez-McDowell talked about are very close to me, so I know that I cannot stand up here and talk about those issues with the professionalism that they did. And just very quickly, another story that connects, because we're talking about interconnectability and how all of those priorities connect. The reason why I left West Virginia in 1997 and moved to Charlotte, North Carolina, I was working for the Department of Health and Human Services, so I worked in some capacity of service all my life. I worked in financial services, determining food stamp, Medicaid, all of those things. But the Department of Health and Human Services was right beside of us. And one day I saw them bring in a 6-month-old baby girl with an STD. I lost it. My supervisor had to send me home. So I found my lane. I'm comfortable in the lane of business and how to get the resources to fix those things that we need to fix. And today I'm before you, I'm going to be making a request. So it gave me time to kind of cough up the butterflies that are in my stomach because I haven't been in front of a group teaching kind of like thing in a while, particularly in front of like adults, college age adults who are judging, and you want to make sure that your information lands the right way. So what I'm hoping to do today is just what I heard Commissioner Powell do in soliciting the board's support in having an ad hoc committee for global trade, specifically small business global trade, with a focus on the African Caribbean diaspora. Now, what my objectives are: present information to dispel the myths about the image, civil development, and profitability of countries on the continent of Africa, present data for support of a marketing and communication model for Mecklenburg County, small minority business owned, and I know that we do have a small minority business advisory. I have not talked to them, you know, in all honesty, in doing this research. I'm used to doing my own research because I'm a researcher, so I wanted to thank certain individuals like Roger Johnson, Dr. Johnson. I had two friends on the outside who are very knowledgeable about specifically African trade, and they have businesses, RHC Workforce and Global Impact Industries, Akofu Dasu, and Dr. Nayakan June, who I will mention later on, and Crystal Mill from the Charlotte International Trade, because I didn't even know we had a Charlotte International Trade Alliance. So what I want to do today is present data for support of a marketing communication model for Mecklenburg County's small minority-owned business that aligns with the most prevalent and profitable services and commodities on the continent of Africa. Form relationships with international trade organizations that will assist Mecklenburg County small business compete in the emerging African global trade diaspora. Other objectives: evaluate and reform data collection. Thought you would like this, Commissioner Griffin. Align the county's priorities of workforce development, Commissioner Altman, and economic development, Commissioner Susan Rodriguez McDowell, with global trade opportunities. Explore the creation of an ad hoc committee for global trade and economic development for small minority-owned businesses with a focus on the continent of Africa. And the reason I'm focused so much on small minority businesses, and I know that that is a priority of the county, is because all of the information that I have been fed so far has been for the larger corporations. And I'm sure that we have an advisory council that reports back to the board on the economic health of small minority businesses. But having talked to small minority business owners in the community, I just have some ideas about how we can take advantage of some opportunities right now in the midst of some threats of diversity, equity, and inclusion going away. So basically, important points in data. Important fact to remember: taxes are how we pay for services. You've heard Chair Jarrell say that all the time. That's how we pay for services. We can't tax our way out of problems, but it's how we pay for services. Taxes are used to mitigate, they're supposed to be used to mitigate the impact of inequality. That's something that we got to remember. So, North Carolina, because of the quality workforce and overall economy of North Carolina, we've been named again as the #1 state to do business in 2025. I think there was one year where we hit #2 or #3. But this year, we were named the #1 state to do business. And there's a few reasons for that have been orchestrated. The #1 reason is because of our tax breaks, right? So currently, the tax rate for businesses is 2.25%, keeping in mind that taxes are how we pay for services, and taxes are how we impact inequality. Current rate is 2.25%. It is projected to be 0 by the year 2030. Now, this ties back to Commissioner Powell's presentation. Another reason why we are the #1 state is because we have the lowest utility and water rates in the nation for corporations. So Duke Energy and the large data centers that are coming here, which use obsessive amounts of water, they like that. We have rates, they drain our resources, and we don't ask for a proportional rate of return on the resources that they use, in my opinion. Important points of data: best ranked and tiered counties in North Carolina to do business: Wake County, Chatham County, Nash County, and Mecklenburg County. And you can see there, I'm not going to read to you the reasons why. Mecklenburg is known as the second largest banking capital. I guess you guys know that already in the country. And Charlotte is the 14th fastest growing city in the country. And because we have Charlotte Douglas International Airport, that's one of our cash cows, right? We don't want control of that to go away. These are benefits only enjoyed by large corporations, not really small businesses, not when you drill down on the numbers. Important fact: taxes are how we pay for services. Taxes are used to mitigate inequality. Does everybody know that now? So, in this current economic environment that is unduly influenced by politics, it's easier for minority businesses to regress, to lose sales, lose market share, which is really, really important for the layman who doesn't understand that, or even go out of business. You know, the average lifespan of a new business is about 15 to 17 months before they go belly up, and that's because they don't have the support that's needed. Global trade opportunities can slow or reduce the impact of those varying threats. Why do we need global trade? And this is something that I really had to do a lot of research on, right? Job creation. In North Carolina, 1.3 million jobs were supported by trade, representing 20% of all jobs in the state. That's just from trade alone. In 2023, 11,000 companies exported goods from North Carolina, of which 87% were small and medium-sized enterprises. So we're leaving money on the table. There's some opportunities there for small businesses to take advantage of. And I'm going to show you why the continent of Africa is prime for us to target like now. In 2022, more than 300 million people were employed by affiliates of companies. At least 50% were foreign-owned. So the foreign-owned companies, when we talk about training students, those foreign languages that they take that are sometimes required, and they're like, I don't need that. I'm never going to use that. Well, you may not think you will ever use it, but it's going to be a benefit to you. We can train our students in CMS for these foreign trade opportunities that are right here on U.S. soil. Education and research. From 2023 to 2024, more than 24,000 international students were enrolled in North Carolina colleges and universities, contributing $914 million to the North Carolina economy. That's significant. So other benefits of global trade on small business: expanded customer base. These are kind of, common sense. Increased revenue and growth, market diversification, reduced competition, access to international government procurement, and trade policy advocacy, which that's a part of what I'm trying to do now. Why does North Carolina need global trade? Exports and growth. Who trades with North Carolina? So North Carolina exported about $72 billion in goods and services to foreign countries in 2023. Now, I know we hear foreign trade and we think tariffs, and that right now it's not a good idea to get into foreign trade. Put a pin in that. So with Canada, you can see the list. Canada, China. Canada is our biggest import-export partner. China, Mexico, Ireland, United Kingdom. Mecklenburg County currently has trade contracts with 39 different countries, but only two South African countries, that should read. South Africa is actually a country on the continent of Africa. So South Africa. So, and I put, there's like a list, I have a list of all of the international companies that Mecklenburg does business with, and if there's someone here from that department that could correct me. We have Sappi Fine Paper, and we have Saf Marine Incorporated. And that's where I need my, let me see if I can pull up my, how do I pull up this spreadsheet now? Click on that Mecklenburg County currently, and a spreadsheet should come up, because I want to show you all of the other countries that we do business with. Only 2 countries on the continent of Africa. There's a lot. There's about 39 to 40 countries that we do, so we'll move on from that. I'm stuck. Just forget about the spreadsheet, if that's what it's trying to do. We don't need the spreadsheet. My point is there's 39 different countries. We only have 2 countries on the continent of Africa. Both of them South African countries, South Africa. And keeping in mind, you know, what I love is that we do our priorities at the beginning of every meeting and session. And what I constantly hear when I look at anything is looking through the lens of equity and equality and what impact that has on Mecklenburg County and all the towns and all the cities, or the city of Charlotte. Still not advancing. Okay, there we go. Now, what I want to do is explain what diaspora means. Diaspora means to disperse. Disperse a group specifically, usually a movement of people away from their ancestral territory. So when you hear people talk about the African Caribbean diaspora, we're talking about the fact that there was a forced disbursement of people from Africa to various regions of the world, right? They may still hold on to a remnant of their culture, the emotional ties to that culture. That's why there's a difference in how we address mental illness and how we address different things, because there is a difference. Diaspora maintains emotional, cultural, or even political ties to the country of origin, in this case, Africa. And Africans were dispersed on these little West Indies, that kind of thing. That's how in Jamaica, that's how we, and of course the transatlantic slave trade, which dispersed many in North Carolina and Georgia. The traditions and active support of homeland affairs. So that's where there's an opportunity for us. The worldwide dispersal of people of African descent, historically linked to forced migration from the transatlantic slave trade, but also including voluntary migrations. It is important because these communities have created a global network that is right here. There's a huge global network with shared heritage contributing significantly to the cultural, economic, and political development of both their new homelands and Africa. So there's a trade, there's a back and forth. You know, we hear all the time about how Africa was raped. Well, now we have an ability to actually provide to the motherland, it's called, of Africa. Myths about African countries. One of the systemic barriers to realizing the vast global trade opportunities of African countries are myths that persist about the continent due to a lack of education on multiple levels of business. Many don't understand that Africa itself is not a country, it is a continent. South Africa is a country. It's composed of 54 different countries. All countries on the continent of Africa are not impoverished or require aid and has They have infrastructure. This is one of the myths that they have. They have no infrastructure to support varying business models. It's a myth that Africa can only provide raw materials and cannot manufacture products or provide progressive services that involve technology. So there is a real raid on precious minerals right now, and I think that's the only thing people think you can get from Africa, right? U.S. companies can't compete with cheaper Chinese and Indian goods. So a lot of times it's more expensive to get things from the continent of Africa than Chinese, or so it's thought, the Chinese and Indian products. Many are unaware of the African Growth and Opportunity Act, AGOA. And what this is, and this is something that I learned, since its enactment in 2000, the African Growth and Opportunity Act has been at the core of U.S. economic policy and commercial engagement with Africa. So there's already a framework that's been set up. There are already rules and regulations that have been incorporated, understanding the political atmosphere and environment of Africa. There are policies already set forth for that. Why Mecklenburg County should pursue African trade. North Carolina itself has seen an 850% increase in African immigrant population from 20,000 residents in 2000 to 190,000 residents in 2023. And I don't have those numbers specifically for Mecklenburg County, but you can assume, and I'll show on the next slide, how many there are in the Charlotte area. There are over 1,200 African-owned businesses in North Carolina contributing to the state's economy. North Carolina hosts 25 African cultural festivals, 450 African cuisine restaurants, and has 3,200 African students in its universities, showcasing a strong cultural impact. The Africa Growth and Opportunity Act has contributed to a 13% growth in trade volume from Africa to the U.S. from 2020 to 2023. Now, that's 13% within 3 years, particularly in agriculture, textiles, and energy sectors. Now, when you're talking anything with regarding the government and trying to set up a foundation, show me the money, right? I feel like I needed to have like sound bites, show me the money right here on these slides. So the future of U.S.-Africa trade relations will focus on sectors like technology, huge technology boom there, and lots of talent that can be utilized here back and forth. Technology, green energy, and materials, specifically precious minerals. I left that off the slide, presenting promising opportunities for both regions between 2024 and 2034, it is projected. Charlotte, we have, and this is basically the Charlotte region, about 45,000. So really the highest population of African immigrants. And I can be fact-checked on any of these things. I welcome that. I kind of relied on some research, both from who Roger Johnson provided me with, and I contacted the Charlotte, I looked at data from the Charlotte Regional Business Alliance. It wasn't disaggregated, and there's not a whole lot of business on Africa specifically. There is on international trade, but not Africa specifically. But look at that, we have 45,000. Raleigh does the most business right now with African countries. They have 32,000. So we're leaving money on the table. Why Mecklenburg County should pursue African trade. It's a platform for navigating the systemic barriers that we have right now. The barriers are getting taller and bigger every single day. November, we will run out of funding for SNAP. Medicaid is on the chopping block. Small business is the economic engine for everyone, everybody, but they get the least incentive from county, from state, it seems to me. And if there are some programs that I'm leaving out that are beneficial to small businesses, please let me know. So this is an avenue of improving small business, helping them, not just giving them, a handout one time or giving them a grant one time, but providing them constant support, technical support to say, okay, you did this right, you did this wrong, reaching out, saying what they need to be successful in this area, which is bountiful, it's plentiful, it's gaining help. But it impacts digital equity. We still have a problem with digital equity. It addresses the social determinants of health and social factors. Definitely policy reform. Imagine being at the forefront of policy reform. Mecklenburg County actually shaping and telling Raleigh what's best for us here in this county as it relates to global trade, and telling them that they should get on board for this because it brings money to the region. It's impacting them specifically. And the community connection. Like I said, we have a large African population here that we need to connect with. So, implementation roadmap and next steps. That's already been put together as well. There are other organizations that have been doing this for a while. Like I said, Raleigh-Durham has an excellent program that they've already established. So establish a county ad hoc advisory committee and ad hoc committee here. I don't know really the difference between just an advisory committee and having a committee that involves both, the Board of County Commission itself. Establishing civil society organization communities, and launch a collaborative innovations with a call to action. In May, I learned our chair invited, or welcomed rather, the BABN, that was in May 2025, and that's the British American Business Network. So you have these hubs that are responsible for working with whatever continent or country and helping them to do business in the U.S. at ports that are most advantageous to them. We don't have a hub for Africa. There's all these other countries, but we don't have one for the continent of Africa. So that is my call to action. So a couple of weeks ago, I reached out to our chair and to our county manager, and they allowed me to go to the Global Africa Summit. And I'm sorry, it was so impactful. It was kind of life-changing for me. I have never met, I pride myself on being able to have a conversation about just about everything in the room, but I used to always teach and tell my students, there's always somebody smarter in the room than you. Even with all of my business acumen, I felt so puny and so small. These people were brilliant, talking about trade, talking about how much money they were bringing in to the U.S. and to their states, and how much money was going back to the countries that they served in Africa. I met some amazing people. So this was the summit. It was held October 14th and 15th. It was in Washington, D.C. at Catholic University. Also a beautiful campus. It was amazing. But it taught me so much, and it just made me realize, instead of, we have and the purpose of all of these cuts is to create chaos and panic. So I always want to be found having at least some options for the panic. Like, what are we going to do? We can't just lay down and die and tell our residents, well, we can't do anything about that. You find avenues to create revenue. And I know that our county manager had talked about foreign direct investment, creating a platform for that and having the county get more involved in that. That our growth was flat at 3%. Well, we can find other ways to improve our growth. So these are just some of the people that presented during the Global Africa Summit. These are pictures from the summit. Like I said, I had such an amazing time. The campus was beautiful. And last week, as a continuation, because Global Trade Awareness Week is actually in November, and I will be having a town hall on November 20th. Dr. Ayakan, let me make sure I'm saying her Nayakan, June, she came and visited me at County Commission office, and that's on the top right side. That's how you see us. She was so proud to be connecting with someone in the United States. She's from Kenya, and she has she sits on boards in Kenya, and she has her own company as well. But she goes around and talks and provides educational information to the states about global opportunities within the continent of Africa. And it was just such an honor to speak with her and hear her talk about business from the standpoint of, and they have the same issues with, being the woman in the room. She talked about how, when she wanted to train women and these young girls to do certain things, that they didn't even make the equipment that would fit the size of them, because that's what they're trying to do now, is to broaden the vision of how they utilize their people. So there's opportunity. There's potential to expand for both Africa and for us. And I am delighted to take any questions.
Well, thank you, Commissioner, for the presentation. Colleagues, before I open it up for question and comments, I need to clarify one thing, Commissioner. Your ask is specific, but I want to make sure when you talk about the committee, are you talking about an ad hoc committee, or are you talking about a standing committee? I mean, I know you used the term ad hoc, and I want to just...
I don't know.
Okay. Just for clarity,
right.
Ad hoc committees are appointed by the chair.
Okay.
Standing committees are the ones that, we certainly, that you're familiar with. And then anytime we talk about committees, obviously it's a resource component,
right.
Particularly on staff, and we only have 9 members of the board too. So I just want to kind of frame that up in the right way when we talk about adding another committee.
Understood.
All right. So thank you for that. And with that being said, I'm going to start with Commissioner Leek, and then we'll go around.
No comment.
No comment?
Not at this point.
All right. I'll go with Commissioner Griffin.
Thank you, Mr. Chairman. Excellent presentation in terms of information about global trade. When you said Mecklenburg County is doing business with 39 different countries, are you referring to Mecklenburg County proper or Mecklenburg County government?
Mecklenburg County proper.
Okay.
Not the government.
Okay. That would, yeah, I mean, I was looking at that. The other piece, because it's economic development, that always catches my ear.
Mm-hmm.
And so we're still awaiting on a policy. At some point, hopefully, we'll have a policy, and maybe some of that may be fleshed out there,
mm-hmm.
or not fleshed out there. But would hope that we'd have a policy that gives some direction to the staff. But right now, we don't have a policy per se. So that might be something way down the road that might be helpful. It may not be helpful. But I wanted to mention that we got to have a policy somewhere to give direction if we're going to try to do something. But my interest was in terms of Mecklenburg County versus Mecklenburg County proper.
Right. These are corporations.
How do you see this body having impact as a county? Are you looking at Mecklenburg County?
Yes.
Us.
Yes.
Versus Mecklenburg County proper.
Yes, I am. And there are so many ways, and I had to find a way to pare it down so that I could get just the briefest of explanations out on the slides. But there is a way to do it. Wake County is doing it. We can look at them as a model. But there are ways that we can have small businesses specifically target that population of people. That's why I wanted to talk about how many people we have here from the continent of Africa or of African descent, how many products and services that we can actually import from Africa. There's already a framework set up, the United States, and between there, we have experts that know how to do this stuff. But it literally blew my mind, the information that I learned at this conference.
Last question. Is it Wake County government doing it, or Wake County? Because we have a regional business alliance that is the engine or the leadership that looks out, domestic and internationally. Is it Wake County government, or is it Wake County?
It is a public-private partnership, so they're both involved. But yes, Wake County government is involved as well. And I don't know, in-depthly, I don't have the numbers as to what they contribute.
Gotcha.
But it is a public-private partnership, and they definitely, have a hub for how to address small business entities rather than just corporations.
Thank you. My time's up. Well, just if you can provide some additional information.
Absolutely.
That would be for clarification, because I was just feeling like some tension between Mecklenburg County per se versus the Regional Business Alliance, because it seemed like some of that, or a big chunk of that, might be, in their
It is.
sphere of
It is. They
operation.
have an FTZ, these foreign, they have zones, right? But that's why I talked about equity and inclusion and looking through a lens of equity, because they have all of these countries, a lot of German countries, and, a lot of British countries, two South African countries.
Okay, thank you. Thank you, Mr. Chairman.
Thank you. Let me go to Commissioner Meyer, then Commissioner,
Rodriguez McDowell.
I've been there before.
Thank you, George.
No.
Doing the most.
Okay, help me out. I'm not sure who to ask, if it's you or if somebody in the room.
We'll get there.
Global trade, and this might go to our attorney. Trade in of itself is a federal. How do we do this? I mean, are there regulations that?
This is not an area where I'm familiar with the
Okay,
county.
Mr. Manager, do you?
Well, I'll go ahead and share my comments about this now. And I've had a conversation with Commissioner YTI about this. I'm looking for clear direction from the board relative to her interest in going down this path. To Tyrone's point, we have to educate ourselves in this space, this global trade. But as she's mentioned, she's attended a couple of conferences. She has a second town hall meeting coming up. I spoke at her first one as well, along with the chair. But in terms of committing resources to continue to pursue this as an area of interest or a priority, I need to hear from you all if this is a collective interest as opposed to me solely working with one commissioner here. I appreciate that direction, whether it's today or at some other point.
Oh, and something I left out with regard to that and tying it back, and this goes to resources. The two areas that, and Mike can attest to this when we met, is workforce development. Those are the only two areas that I'm looking at. Research studies, to your point, Attorney Wade, and workforce development. Those are the only two areas. I'm not talking about getting deeply, heavily into trade. Those are the two items. You have to crawl before you can walk. Obviously, we need to educate ourselves in this whole thing. So I kind of rushed through, left that out. But those are the two specific areas that we see the most promise: workforce development and research studies.
Well, I am not at all opposed to looking into it and finding out what we can do as a county. I'm totally in support of, more options to do business and to better this county. So I'm not sure. I'm not sure really what I'm thinking right now, if that makes sense. Like, I'm still learning about this, so I have to think about this, but.
And that's fair, and I've got white papers, I've trudged through a bunch of research and done a lot of research myself. And this is my way of contributing as a solution to a portion of what we do. That's why I said narrowly, workforce development and research.
All right, well, thank you. I appreciate your presentation.
Thank you. Commissioner Rodriguez McDowell.
Thank you, Mr. Chairman. I'm pretty sure at one point you talked about tariffs and you said put a pin in it. And did you come back to that?
I did not come back to that, but you're right.
I was listening for it because I was like, okay.
Yeah, so going back to the AGORA, that is connected to the whole tariff thing. There are certain countries that have been excluded from certain tariffs and things of that nature. Right now, since we don't do a whole lot of business, then those tariffs are excluded. So there's kind of an opportunity, but like I said, that is something that's further down the road. That's just my way of explaining that there is opportunity here. the two things that I want us to focus on is the workforce development, education, and research.
Okay, I'm a little disconnected on the workforce development, like how does it pertain? Like, I don't get the connection.
I know. And it's, like I said, this was a weighty subject to just put in 15 to 16 slides. What I'm thinking, and I just alluded to it a little bit, is training our young people on what is needed to do business with these global corporations that are already here, as well as those that we could potentially partner with on the continent of Africa, because there is a demand, a need for it. Just like we didn't know that, there's a need for certain trades, there's a need for, so we can train our young people. If we expose them to the right thing and they have that interest, they may want to travel to Africa for an exchange program, but there is a way to incorporate and increase our workforce development with the demand that is there for countries in Africa.
I'll talk to you about it.
Okay, thank you.
Thank you. Commissioner Powell?
Well, thank you for your presentation.
Yes.
Like, I always love to hear new ideas. But I'm just wondering, I feel like we need so much more information from, I loved Arthur's questions. I feel like we need a lot more information about like what we're allowed to do and our role in this, and really, is this the space of the Regional Business Alliance? And so I'm just wondering, like, if I need more clarity on, our role in this, and I don't have it.
Right, and again, I'm not asking for anyone to make a decision today. I'm saying that this is something that we can pursue, number one. We have economic development, yeah, that's in their wheelhouse too. What I'm saying is there is a lack of equity in the countries that are being targeted for development, and we're leaving money and opportunity on the table, and we can use our small businesses and train them on how to get those commodities, especially goods and services and things of that nature, and workforce development specifically, training their people and training our students. So there's opportunity there. This is in no way, there's no way I can provide all of the information that you need to make a decision, probably within the next, but I wanted to introduce it because it is part of our job.
I appreciate it because, like the conversation you have to have a conversation sometimes to spur action. And I have to, I don't know if this is the right place for action, but North Carolina needs to pay attention to, who we are having trade with. And so, from your slides, it looks like they need to pay better attention to it. So how do we spur that action if it's not us? Like, your voice matters, like you bringing this up matters. So.
And I want to directly talk about the small businesses, because all of those things that I talked about impact, like on the Economic Development Committee, what I've been able to sit on before. I don't sit on the committee, but what I've been able to see so far are the benefits to corporations, not to our small businesses, and certainly not to our small minority women business enterprises. So,
thank you. Thank you.
Thank you. Commissioner Altman.
Thank you, Commissioner YTI. I really enjoyed learning about the African diaspora, and particularly as represented in Mecklenburg County in the state of North Carolina. That's extremely interesting to me. I am concerned about the lack of ties. We certainly want to be sure that we are pursuing economic opportunities wherever they may be, and that's quite a difference that you've got up there on that slide. So I look forward to hearing from Dr. Johnson when she's back in town. I would really like to get her lens, get her recommendations, but as a member of the Economic Development Committee, and I am interested in ensuring we're leaving no stone unturned in terms of recruiting great businesses to come to Mecklenburg County and bringing great jobs and workforce development.
And again, I want to emphasize, I'm not talking about bringing corporations to North Carolina with regard to trade. There's a lot to unpack here.
So with respect
I'm talking
to
about
your
small
comment,
business.
Vice Chair, before I have staff tied up with taking this on, I need direction from you all.
Okay, Commissioner Dunlap.
I think the difficulty, and you can tell the uneasiness about this discussion among the commissioners in that I, for one, am not certain that this is something that we should be pursuing or anything that really affects what we do from a budgeting standpoint, which is what I thought most of these discussions were about. Additionally, I don't know that this is even our responsibility. And I thought Commissioner Leak would talk about this earlier, but Commissioner Leak started a small business consortium, and as a part of that, there were people from the African diaspora who coordinated efforts to bring business to Mecklenburg County, but it was initiated by them as opposed to something being initiated by us, and she could tell you more about that. But in terms of setting up an ad hoc committee, the chair has the prerogative to do that. Ad hoc committees are appointed for a specific purpose for a specific time. He can start them and end them whenever he wants to. But in terms of making it a board function, one of the standing committees, it would take a vote of 5 people to do that. It would be staffed by 4 commissioners. I think most people at this point are already committed to areas of interest. I know that there's some of you who are doing more than your share of serving on committees. And I don't know that there's more than we can do other than to eliminate a committee that currently exists. And I don't know that anybody is willing to do that. I think the manager is fair to hear from the commissioners about whether or not that's something that we want to invest time and money in. And I'll just speak for myself. I don't see it.
And that's fair, and I understand. This is actually, as I'm thinking about it, this is my 3 minutes that Elaine talked about. Something that I'm passionate about because, again, I don't see small businesses being incentivized or helped. I feel like they're marginalized, and I feel like there is an opportunity within Africa and trading with those countries and teaching them how to get additional monies. And again, we talked about foreign direct investment and things of that nature. So it is a way to get additional revenue. And just like we see a need for Economic Development Committee, this is another avenue for that. Because economic development deals with corporations, not with small businesses. And I understand we have a small business advisory board, but do we have a report out on a routine basis from them?
Yeah, sure.
So I really appreciate the last part you said. I want to just put on the radar, and please correct me if needed, but my recollection is that we are undertaking an economic development to come up with additional criteria to ensure that our TIG and BIP incentives can become more accessible to smaller groups, because we want to be sure the taxpayer is always positive, tax revenue positive, but we are, I know we've discussed, looking to ways to broaden the work in economic development. I'm not dreaming this, right? To access smaller businesses.
And maybe that's what it is. It becomes a part of economic development, and that's something like they can take on so that we can get them the opportunities that they need.
Right, and so I just wanted to make sure that that was out in the
atmosphere,
public
yes.
domain here, because I do think that is, thank you, 2.0, that is being worked on by staff.
Commissioner Rodriguez-McDowell.
Yeah, I just wanted to mention that we do have, I mean, I'm super proud of what we've been doing in the minority small business space. And I think maybe we need to, it might be good for us to do a presentation around where we started and where we've come to in economic development around, with what Jamilia's doing and Janelli and all those guys. Like, they're doing amazing work. And it kind of bristles me a little bit when I hear you say we're not doing anything for small, minority businesses, because we really are. And our Economic Development Committee is not just about large corporations, but I think what the vice chair was getting to is that the BIPs and the TIGs, those kinds of things are usually set up around those larger corporations. But as she mentioned, we have always been, as long as I've been on Economic Development Committee, trying to push down whatever we can do towards small businesses. Because
And I apologize. I didn't mean to insinuate or specifically state that we're not. I just feel like, just from what I've seen, again.
Yeah, so I think we might need to, have a presentation around that, or maybe, we can meet with you and talk about where we were and where we've come. And it might be a great topic for us as a refresher, because like you're fairly new to the board, so maybe we haven't done it since you've been here. And so maybe that would be a great topic for us to do on one of our meetings.
Yeah, absolutely. Jamila has done an amazing job. That whole department does an amazing job, and I did not mean to minimize that and the work that they've done.
Yeah.
It's just that I see an opportunity because of the environment that we're in right now.
Right.
That is my point.
And I didn't want to be unkind in any kind of way, but I have to agree with Commissioner Dunlap that I think we're pretty stretched where we are, and I can't see anything that I would give up in order to bring another committee into my world. So I just wanted to put that out there.
So let me go to Commissioner Leak.
Let me first say thank you to the board for listening. I'm not going to get involved beyond what I've already done and still doing. I started with 4 women as a small business consortium, and it worked well. We had 400 and 500 people that would come to my meetings, even from out of the state, even from out of the country, but not to the point that you are speaking of to start a new committee. We have an Economic Development Committee, but I would like to talk with our manager first, because nobody can speak for me but me, because I did the work. And it was successful, and it's still successful. And I sent 9 women to Africa. Didn't ask a dime from the county, from anybody. I gave money. They paid part of their way. So I don't want to go into a long discussion. And we had a wonderful fellowship. I can't even begin to talk about it. Many of you have experienced being with me with this process because I invited you to come. But it's not at the point where I would recommend that we set up a board, that we have 5 people to 9 people or whatever to set up a committee. I plan to talk to the manager first before I continue to move forward beyond what I'm doing and will continue to do without money from the county.
That's totally fair, and I appreciate that. Like I said, there are lots of things that I need to learn, but like I said, I'm going on things that I see a need with. And
I didn't say that for any.
No. I have been told constantly about your contributions to small businesses, and that you have standing room only town halls with regard to that. I'm trying to zero in on, again, an opportunity. If we spend money and give incentives to certain groups, certainly, if we say we're going to do business looking at a lens of equity, then I want it to be equitable to small minority businesses and just evaluating how we provide services to them.
Okay, thank you. So let me say a couple of things just to wrap this up. One, thank you for the presentation. where I'm at right now is we're not even close to an ad hoc committee from my perspective as chair at this point. I think what I've heard from my colleagues is that excellent information, great perspective. The disconnect may be a little bit of understanding what our role would be, particularly when we frame it as global trade. When you funnel it down to small business, I think there would be a consensus here that we are working with small businesses. Now, is there a possibility, or is it possible for us to look at immigrant small businesses? I think we need to talk to Jamelia and others, which that would be on you, to figure out how do we engage with that subset of the population.
We
right?
already do that, and that's
So
what I'm
hold
saying.
on, Commissioner, let me finish.
Okay.
So if we're already doing that, then there would be a level of redundancy that I think the board has always had apprehension with respect to redundancy, if we're already doing that. So what is it, and I'm just putting this challenge out there, what is it that we're not doing that you would ask the board or that staff would need additional resources to penetrate deeper in, whatever area? But I think, and to tie that to the workforce priority, if there's a tie to that, help us understand what that tie. But if we start with global trade, I think there's just going to be a disconnect with not just the board, but the staff on how we impact what the county's role would be with respect to global trade. Big picture. The second thing is, if Wake County government is doing this, I would be curious from David, Mr. Manager, to see what that is. I mean, we can reach out, because I would be curious to know what that is. And to see what that does look like. But I think where most of us are right now is support for small businesses, number one, our immigrant community and what they can add to this community. And also, I think when we talk about role of government, I think it's possible that our role could be facilitation, working with our partners like the Alliance. Right? So what do they do to impact this? Because they already have this structure, this resource that is recruiting businesses and things of that nature. So what I would ask you to do is continue to help educate us. This was a first shot, to your point, this was a first stab at this to help us through it. And then, we can continue to have that conversation. But I think it's going to be a little tough, and I want to be able to help where I can, but to facilitate staff resources is going to be very difficult until we can get a little further down the line.
Yeah, I think that was probably too big of an ask. But just to your point, like we have, I think it's called, what's it's a Latino group. So they have like these hubs, and that's
Spark Central. Through the Latin American Coalition?
We have coalitions, but the one that does not seem to have any help from the Charlotte Regional Business Alliance, they couldn't help me. There's no African countries, and we have a large African population. We have no hub here. We have no direction. So again, through the lens of equity, we have a large group of folks here, and trade was way too big to dream about. But from the standpoint of workforce development, developing our students to speak certain languages, to prepare them for jobs that are already here. Like we have students that learn jobs for Siemens, to speak German and things of that nature. We don't prepare students for.
So I don't think we would disagree. I think one of the things that this board, and I want us to be consistent with respect to the way we approach things. So everybody in their presentations has referenced data. You've given us good data, but then when you come down and you talk about this particular group doesn't have a hub, what would be helpful and useful with your contacts, if you bubbled up to us and said, hey, out of the 3,500 African immigrant businesses in Mecklenburg County, this is what they're saying the need is, or, giving us more meat on the bone would just be helpful, because right now, we just don't have that perspective to say, we trust what you're saying, but we don't have that perspective of the community saying, hey, we need this, and we're missing this, and this is a gap to fill.
That's understood.
We don't even have know what resources would be needed or investment. So we just have to have a lot more meat on the bone. To your point earlier, I think this is a great first pass, high level overview. Now, if you want to drill it down into the workforce component and the other bucket that you name, let's
Research
kind
and
of
education.
Yeah, let's kind of sharpen that up.
Thank you. That's all I ask.
Thank you, ma'am.
Sorry. So, Chair, there is one more item on the agenda. However, if it is the board's pleasure, we can reschedule that for a public policy workshop meeting. I did speak with Adrian about it. It's about 12 minutes. However, I know we did have some discussion about leaving some time for the board to talk amongst yourselves. So we're fine rescheduling this for November 12th. This is an update on the deep dive assessment on our budget.
Are you guys all right with just ended up with a little bit more of a free-flow discussion, and then the manager is going to give us an update on something as well before we get out of here. But before I open it up to board members, what I'd like to accomplish in this next 15 minutes or so is just, every time I have a meeting, and when I leave a meeting, before I leave the meeting with somebody, I always ask them, and I want to make sure, did you get everything out of this meeting that you needed to? Or that you wanted to? Was there anything that was left unsaid? And I want to pose that to us to say, was there something that you did not get an opportunity just to put in the room, to share, to ask for reaction, feedback, thoughts, or anything else that we should take up as a board? This is an opportunity for us to just have some family time, I'll call it. So who would like to kick us off with any particular thoughts? And I know I'm putting you guys on the spot, but Commissioner Griffin is moving his microphone. Go for it.
Put me on the spot.
Yes, sir.
Thank you, Mr. Chairman. I'll try to be within my 3 minutes. When I spoke to the manager about this process, he said, I want to know your why. And I had, I think I sent you 5, 6, 7 different things. You got to pick one. So I picked one, which is workforce development. But let me give you my why. I don't think I gave you my why. I grew up here in Charlotte. I grew up in a 3-room house called Shotgun House. My mom and dad separated early on, okay? Had 0 reading material in the house. My dad could not read or write. He signed his name with an X. And it was my community that had high expectations and hope in terms of Black excellence. And from that beginning, in terms of my why, my last job was a senior vice president on the 12th floor of Tupan Plaza in Manhattan, supervising a whole bunch of folks, probably a lot smarter than me. We did peer work with Standard & Poor's, which was one of our businesses. And one of the things I was helping one of the senior managers with is how do we find minority candidates to work for Standard & Poor's, which is the rating agency. This is probably 2010. We're trying to find young African Americans in finance with an MBA from Columbia, Penn, you name it. Every time we would find one, offer $250,000 annual salary, which is not a lot of money in Manhattan, but $250,000 is a lot of money for any young person. As soon as you find one, the streets, meaning Wall Street, would scoop them up. And so from my experience, which is, you inspect what you expect. My whole experience has been data. Those old Black teachers around me, those old Black teachers around me said, you can say what you want to say outside the classroom. Inside the classroom, you speak the King's English. So when I ask for data, it's not about summative stuff. It's formative, to give me some idea which direction we're going. because that's my experience. And some young folk, sometimes make the comment, black people are resilient. You can't be no more resilient than my experience, and all the people that grew up with me have done very well. And so when I talk about data with staff, it's not from a negative perspective, it's from a formative perspective. How do we do better? And the reason why I embrace this discussion is because of what I've seen happen as a result of balanced scorecard and SMART goals. Black kids were at 30% college and career ready. We adopted this program, and in 4 years, we moved it to 60% third grade college and career ready. And we got messed up with a lawsuit on school desegregation in 1997. We could have kept moving that number because we were intentional. My why on this board is not to be a politician or to get reelected again. If people don't vote for me, that's fine. But while I'm here, it's not so much about helping individuals as it is at supporting a system that helps many, many more folk. But Mr. Manager, and for my colleagues, that's my experience. Dr. Washington, check my mom's death certificate. Mary Wimbush Griffin. She died homeless right here in Charlotte. They didn't even know what last name to put on her death certificate. So I understand African American and Black resilience. I also understand Black excellence. And what I see in this community right now is a reluctance to embrace Black excellence. So I'm going to continue to push this, and y'all might push back. I'm going to push you again. But I think hope is the aphrodisiac for change, and we're missing hope in my community, and I think the broader community. And that's why you have so many problems with juvenile crime.
That's right.
Is that youngsters have missed hope. We need to provide that leadership in what we do as a county. So, Mr. Manager, I hope I answered your question. Why?
You did.
Am I doing this work? And why do I support the approach you're doing? Thank you, Mr. Chairman.
Commissioner Meyer and Commissioner Lee.
Thank you. Thank you for that, Commissioner Griffin. I really appreciate your truth and your honesty, and that just goes for all of us. I really appreciate the why, and I think that is one of the main reasons we were brought here to talk about the why, and I hope that it gives some kind of clarification to staff on why we push on some of the things we each push for and push on. So thank you, and thank you for this opportunity. Really do appreciate it.
Commissioner Lee.
I'm going to piggyback on what Mr. Griffin has stated. As a Black woman, I came from a family of a mother and a father who was church and educated in my whole family. The first time I heard about politics was with my mother and father, walking with them to put out literature so that Black people could get elected. Because if you ran 2 or 3, they would not get elected. In my high school, we had choir, debate, a segregated school. We walked to school, and the white kids rode the bus and spit on us as they passed us. And the uniforms that we had came from the high school. So the colors we could not select, nor could we even decide what books we would use. All of our books were passed down from the previous high school to this high school that we attended. My struggle has been a fight for my people. And when I say my people, that's all I heard at home. There was a young man being executed in my city. Didn't know what it was, but the community was rallying around this young man and his family because they accused him of an incident that he was not guilty of. But they executed him anyway. And what the parents did was took us to Raleigh to stand outside the gate so we could hear and see what was going on. as children, so we would not forget it. I'm saying that to say this. Arthur used to come to the church my husband pastored and drank hot chocolate and had fellowship with the children and the people there at that church. So I've known Arthur a long time. I thought I was grown and he thought he was grown. The choir, the debate, many of us acquired a way to speak because of debate and speeches at Easter time and Christmas time. This was a part of our heritage. And people wonder why I am I don't call myself aggressive, but I've lived through the civil rights movement. And I can recall 3 crosses being burned in the front of my home in Gastonia. I had gotten on the bus to go get a shirt for my son from the store. And the bus driver said, and I sat right down, put my dime in, and the bus driver said, "Nigger, you got to get to the back of the bus." He didn't say lady, he didn't say young lady or anything. He said, "Nigger, get to the back of the bus." So I got off the bus and went home. My husband came back. 5 carloads of policemen came to arrest him because we were speaking about riding the bus, paying our fee, and not allowed to do so. So this has been a part of who I am. And when I talk about black kids are not being educated, they're not being educated, either from the parents and the community. And the school system is certainly failing them. They talk anyway, they dress anyway, and disrespect authority. So we have a long ways to go. So the question to me has been, has integration killed us, or has it prepared us? Has integration killed us, or has it prepared us? So that's the question we hear a lot. And I'm still very active, debate team, choir, patrolman. Used to have patrolmen at school that stood in the hallway. So and I'll finish that later. But because of those experiences have kept me on the fight for the rights of women who are black, who are denied many times by black men and disrespected by black men. And I'll get into that later. But all I'm saying to you, I'm grateful that the community has elected me. I've worked hard as a teacher. I've worked hard as a community worker. And I'm just grateful to be here and thankful for the people of District 2 that continue to elect me on the basis of what they see me do with them and for them. Not because you don't want me here, because many of you don't want me here. Would like to see me gone, but you better be careful.
Thank you, Commissioner. Commissioner Rodriguez-McDowell.
Better be careful.
Well, gosh, sure is hard to speak after hearing from our colleagues. You know, it is really great to be together and to hear the why and to hear a little nuggets of who we are and why it makes us who we are, what makes us tick and stuff like that. And so I just want to say thank you for sharing, everyone who shared some, personal nuggets and revealed, your personal passions. I think it really, I think getting to know one another on a different level is just great. I mean, it just helps. I think it makes us more collaborative and can only help steer the board in the best possible ways. And so I think for that reason, this is a home run to have this kind of time together. And I just I remember when we first were elected and we went on a board retreat, and we had to do some of those get-to-know-you things, you know, and it can be awkward, right? But anyways, I just want to say thank you for sharing who you are, and for each person who shared some vulnerability with us. I think it takes courage to do that, and I just want to say I'm grateful to be a part of this board.
Well said. New kid on the block, you're not going last.
Thank you for that. I appreciate that. I want to say again, I think this was an amazing idea, especially being new. I learned so much every single day. I make it a point not to come away from any event, any occasion that we're together and not learn something, if only to be able to be a better human and to do things better for the people that I serve, because I have a servant's heart. That's all I've ever done is service. I have degrees that say business, but I try to use that business to serve people. And I will spend the next 3 nights, because I'm a Virgo, thinking about what I shouldn't have put in that presentation, what I should have started with, or what I didn't. But this was a vision that God gave me to impact small businesses and a specific group of small business owners that I've heard from who said they feel left out. Now, you're absolutely right. I probably should have teed up with that. But there is, whenever we're trying to, through a lens of equity, and I see an opportunity for us to do that, because, it was asked earlier in the week on the dais, well, help me get there. There are some things that we're never going to be able to express. You can't live the things that we've lived, like, I'm not going to live the same things and have the same experiences that Commissioner Leak had, and thank you you did that so I wouldn't have to. I stand on your shoulders, right? I've never been called a nigga, even coming from West Virginia. My dad probably has, my mom, but I haven't. So I want to make it incrementally better, just a little bit better for students that come before me. I'm sure there are people that just did not understand that darn internet thing before. And I'm not saying that, and I don't want to make it seem like I'm diminishing what we've already done. That is not my point. That was not my intent. We have excellent services and points. I want to be able to make a contribution to that. I see a need. I want to help fulfill that need. And so that is my aim, and I will continue to do it, find a way. Thank you.
Thank you. Commissioner Powell.
So is this, I missed the question. What's the question? I love everyone's speeches, but I was like, what is the question?
Well, there was no real question. It's just if there's anything you want to put in the room, in the atmosphere,
Okay.
your thoughts on
All right.
how you felt.
So I'm super thankful. I feel so much gratitude for today. And it was emotional. There's a couple times where I'm so proud of everyone. Nobody needed tissues. There's a time when I was up there and I was telling you about the 4-year-old that was clinically dead, and his mother grabbed my arm and asked me for a camera. I forgot to tell you why, because I didn't understand, but I wanted to get her one because it was so urgent. And she thought it would be the last time that she ever saw him, and that's what it was for. But he survived. And then when I went to the restroom, I ran into somebody from air quality just by serendipity, and which is how I missed the question, got to thank them for their work, because they're not part of this meeting today. But I am reminded, I think some of you know that I grew up surrounded by nuns, many different nuns, and I keep thinking of them all day long and even what Commissioner Jarrell says sometimes, we want people to consider different perspectives and respect different perspectives and have that ability of your mind. And I can see one of the nuns standing in front of me unzip your mind and try to defend their position, And I feel like we all unzipped our minds today to listen to other people's perspectives and how beautiful they were, you know? So I heard Commissioner Griffin like talking about hope and, you know, other people like, you know, public good and hope and struggles, and it's all connected. We have a responsibility as elected leaders to work for public good. There are many different areas that need our attention. How do we do it in a balanced way? So I just am real thankful for today. I'm not going to lose my perseverance ever, ever. And I just can't begin to ever honor Rusty Rozelle enough. I carry him with me every day, and he is the reason I even requested my maps, because he said, Commissioner Powell, we were sitting together on March 17th, and he said, Commissioner Powell, when you see it, you will never forget it. And so you guys got to see it today, and I carry him with me. Thank you.
Thank you. Commissioner Dunlap?
I don't know if I told my why either, but I'll try to make it quick. To look at me is not to know what I've been through. Most of you wouldn't realize or believe that I picked cotton as a child. That was my very first job. I never lived with either of my parents. I grew up poor. And so I endured some of the same hardships that you've heard around this dais today. And my promise and commitment to others is that they wouldn't have to go through what I went through. And so I fight for the homeless. I fight for those who are considered the underprivileged. Because what I realized as I grew up was that it wasn't about the material things that you had. It was about what you had in your head. And so it's important to me to make sure that kids get a good education. As a single parent, I fought for that for my son. Most of you know that he is a PhD in mechanical engineering, and he fights for the same thing for his children. And so that's how you break the cycle, is you fight for what you want to have for other children, for other people. And so that is why I enjoy the privilege of representing the communities that have chosen me to represent them. And that is why I'm not ashamed to speak up and to speak out about things that I don't agree with. But through all of that, I will say that I am blessed to have a good life. I used to resent my brothers and sisters on my dad's side because I thought they had everything, only to find out after my dad had passed that they didn't have much either. So I am still committed to this fight, and I'm still committed to representing my constituents, and I still look forward to advocating for everybody to have a better life.
I want to thank my board members. It has truly been an honor. Thank you, Mr. Manager, LaShawn Carter, and to everybody in the room. I know we would hear similar such stories from all of y'all, and I look forward one-on-one to getting to hear your why. And God bless you all.
Thank you. Well, I want to thank everybody for sharing, number one. Number two, on behalf of the board, I want to thank our manager, because I know, and we know, excuse me, how much energy and time and effort it takes away from staff to do a mid-year retreat. So to pull something like this off, I want to thank you for your leadership, Mr. Manager. I want to thank all the staff that's in the room or anybody that had anything to do with this. LaShawn, it's very rare, and you've done this on multiple occasions with me. I have something in my head, i.e. equity investments, or I forgot what we call it now, but you're able to help me translate it, and Mr. Manager, you're able to help me execute it. And of course, I have the best colleagues on the planet. So I just can't thank everyone enough, not just me personally, but on behalf of the board. The second thing I would like the production team to please stand up for just a second. Would you guys just stand up? Everyone on that back row, stand up. Everyone. There we go. Thank you. Thank you all, because you didn't get a chance to participate in any exercises, but you allow us to execute and you keep the show going. So on behalf of the board, we're certainly thankful. I want to add a couple of things. I want to really just say thank you, colleagues. This was something different, and you could have easily, hemmed and hawed or said, what's the value in it? Why are we having to do something different? And you all embraced it. I mean, put yourselves out there in a way that showed vulnerability and it showed courage. And it's exactly why each and every one of you are elected by the people that have chosen you to represent them, because you do lead with courage. And you lead with honor, and you lead with integrity. And regardless of the disagreements or the differences in perspectives, we were able to maintain a level of decorum that the community deserves and that they expect. And so I just want to say thank you guys for that. Commissioner Rodriguez-McDowell reminded me at lunch that I didn't share a part of a story, but during these past 2 days, I can tell you I thought of a lot of things. And sometimes I sit at the dais and I am somewhat overwhelmed by the opportunity that I've been provided and the responsibility that comes with that and the weight that it comes with. And it's never lost on me the shoulders that I stand on that even allowed it for this opportunity. It's not one time. I think about being able to serve with all of you all, but in particular, for me as an African-American man, it hits different to be able to sit next to a Commissioner Leak, a Commissioner Griffin, and a Commissioner Dunlap, who have more years of service, who have forgotten more than I'll ever learn, but who served during times when this was not common.
That's right.
And so that is never lost on me. So when you guys ask, when the community may ask, why do you give Commissioner Lee so much leeway sometimes?
Never.
Because she's earned it. She's earned it. I've been on the phone with her and heard stories of her childhood and things that she's endured that I don't even have the fortitude to have been able to endure them in any way, shape, or form. I would have wilted, folded, hid in a corner somewhere. And for somebody to have that level of strength, and I have the privilege of sitting next to her I certainly want to give an extra 30 seconds to 60 seconds. When I think about the legend in Commissioner Griffin and what he's meant to this community as chairing the school board and the history that he has accomplished, not just in Mecklenburg County, but just across this state and what he represents in the country, it's surreal that I'm in the same bubble. I told Commissioner Dunlap one time, I said, do you realize that in aggregate, you have more years of service when you think about law enforcement, the school board, the county commission, and the impact that you've had 6 years as chair of this board, guiding us through the worst economic and health crisis that we have ever seen. And he did this job for 6 years. Again, someone like me would have wilted, would have folded. And he led with integrity, he led with strength, he led from the heart. George, you gave us a lesson in leadership that was a master's class. And I could go around the dais and speak about each and every one of you in what you mean and what you brought to this community. And I am just very, very thankful and fortunate to be able to serve with you all. You know, my why is not different than anyone else. I think I know we all care. We do this work because we care deeply, and we're affected by what happens to people. We're affected by the data that we see. We are driven by wanting to make a change and improve the quality of life of everyone in Mecklenburg County. And we all bring these perspectives, and we have to know that we are better together, that grace should be the order of the day, that we should be able to move on and move beyond small disagreements. We should be able to keep our eyes on the North Star, which is and should always be the people of Mecklenburg County, those who are coming behind us, those who don't have the opportunity to be in a fall retreat in the middle of the day. We should always have the North Star of that parent that is thinking tonight about, are they going to eat, or are they going to walk in the house and the lights are cut off? Or someone that's a victim of abuse or gun violence or living in circumstances that are just tumultuous beyond our comprehension. And so I know that we have that lens, and I'm thankful for each and every one of you. And I thank you for extending the grace that you've extended to do this and for us to continue to do this work. I pray that we leave here better. I pray that we leave here motivated. I pray that we will leave here in even closer than what we came in. So thank you for that, and I will turn it over to the manager for
Before the manager speaks, I got to do this as one of the seniors here. You said in January or before January that you'd like to have an opportunity for the Board of County Commissioners to just have opportunity to just talk and speak among ourselves together, a recentering. And you did that. And I want to say on behalf, I can't even speak for the rest of the board members, but I want to give you a hand because I appreciate your leadership, young man.
You do.
Take it away, Mr. Manager.
Wow.
Integrity.
You know, sometimes when things are said, it doesn't require follow-up, and just kind of let things be. And I wish I could do that today, but there are some updates I need to provide to you. So I want to bottle up all of the comments that have been made and put that to the side, and I'll that I provide you this update, I will shift back to giving my thank yous. I'm going to forego the recap like I provided on yesterday for today because I want to share with you a status update on where we are with the SNAP benefits situation. You hadn't received an update, a formal update from staff since I think it was the October 7th board meeting that Lisette presented to you all, and we committed to you and keep you informed. And since we have you here today, I thought it would be appropriate to give you a status update, particularly in light of the November 1st deadline approaching. Before I share this update with you, I want to thank Dr. Campbell, Yolanda Griffin, and Lisette, and some of the others that have provided this information to me while I was engaging with you during the retreat today. So just to level set, the U.S. Department of Agriculture has directed the North Carolina Department of Health and Human Services to suspend the issuance of November 2025 SNAP benefits, here known in North Carolina as Food and Nutrition Services, due to the ongoing federal government shutdown. Per the USDA memorandum, which is dated October 24th, 2025, the suspension of benefits does not affect the ongoing determination of eligibility of applicant households. Therefore, all counties are expected to continue normal operations for application intake and processing in accordance with federal and state policies. So what am I saying? The individuals should still apply for those benefits with respect of what is looming on November 1st. So how has what I shared with you, the aforementioned, been communicated to the public? A press release was issued on yesterday, October 27th. Also, direct text messages to these participants were sent as well. And then in addition to that, social media and traditional media outreach has been performed also. SNAP benefits are 100% federally funded, as you know. States are not permitted to issue benefits using state funds with the expectation of federal reimbursement. We, the county, are currently engaging with our community partners. This has been going on, started on yesterday, actually late last week. When we engaged, we notched up our engagement with our community partners and food resource organizations to mobilize a plan to help get food in the hands of families with acknowledgement that county doesn't have the resources to make up for the SNAP benefit freeze. Made that very clear back on October 7th. The North Carolina DHHS is meeting with our directors, our DSS directors. Yolanda will be attending that meeting tomorrow, and possibly Dr. Campbell as well. They're participating in those meetings to discuss strategies and also hear from our peer county directors in terms of how they're responding to what is going on. And then also, you recall, as shared with you on October 7th, our response will factor how the state is going to respond to what has happened at the federal level as well. So all of those discussions will occur tomorrow. At a minimum, we will expand our food pantry capacity with our partners. And the reality is, we will not have enough food to serve the 63,000 Mecklenburg County households that are receiving SNAP benefits. The cost to provide these families a 7-day supply of food boxes, the cost to provide this would be $2.8 million a week. That's nearly $3 million on a weekly basis. And as of September of 2025, the monthly value of SNAP benefits is $24 million. Hence why I say, again, no county in this state is in a position to supplement the funding associated with this benefit. So again, the monthly value as of September, $24.3 million, which breaks down to $175 per participant. There's a total of 138,460 participants that make up that 63,000 household number that I referenced. We anticipate having additional information and recommendations from these discussions by this Friday. Again, conversations with the state, our county peers will be occurring. I'm traveling to Raleigh tomorrow to attend NACO's Business of Counties session, so I'll be there with David our Wake County manager, and he and I plan to have some discussions about how we're going to respond to this as well. I'll share that with the team accordingly. But I wanted to give you a status update on where we are with this. We are prepared to respond to any question that you may have, but I can assure you that just like the last update, that we are all in on this, taking it very seriously in light of the hand that we've been dealt relative to what we can and cannot do. So our efforts is not to supplant because we can't do that, but it's to try to minimize the impact, the blow that is associated with this. Now, of course, if there is a budget in place by November 1st, then we're at a good place. But if not, we're prepared to have a plan of action moving forward. And we'll continue to keep you abreast, more than likely at your meeting next week, Wednesday, because of Election Day. You'll probably get another update at that point of time as well, pending how things play out between now and November 1st. That includes my update on that item, Mr. Chair. Happy to take any questions.
So let me do this, because I know everyone is concerned about this, but let me set the stage real quick. One, the manager said there's a meeting tomorrow. Yolanda, Dr. Campbell may be a part of that as well. So we'll have more information at that point, which will be communicated to the manager. What I will make sure, obviously, the manager and I will be in communication. So I will make sure that I'm communicating to the board all the pertinent pieces that need to be communicated for awareness purposes. But I think two of the big takeaways that was said, we're not allowed, well, it's costly, number one, to try to supplant that level of funding that's supposed to come from the feds. There is no reimbursement for that as well. 63,000 people potentially impacted. And then we are also, I'm sorry?
Households.
63,000 households, excuse me. Thank you for that. And we're also coordinating with partners. And so my goal will be to communicate with this board to make sure that the community is continuously communicated to, so everyone is very clear on what our role is, what the plan is, and how we plan to impact this. But as I know information, I will send it out to us as board members. Obviously, that does not preclude anyone from reaching out to the manager directly, but I would just ask, as they're in those meetings, to not just arbitrarily let's pepper every communication. Let's allow them to get and gather as much as possible, because it may answer our questions. Commissioner Rodriguez-McDowell.
Can you just help us understand what are some of the possible things that you're thinking of, or the manager's thinking of, when you say a plan, or what we might do, or how we might respond to this?
What I'm comfortable saying now, because I don't want to be committal, because we have to have these conversations with our partners. I'm sure you understand that. But the focus is partnering with our pantries. But even then,
with who?
Our food pantries.
Food pantries.
But
okay.
even then, they have a limited supply. When you talk about the number, the 63,000 households, and who knows how long this may last. But beyond that, I'm a little reluctant to say at this point.
Okay, thank you.
Commissioner Griffin.
Yeah, what I would hope, once you get that information with the chair on Friday, I think that's the 31st, November 1st is the next day, that whatever in big print on our website or whatever it is, that people have some idea in terms of continue to apply, or whatever the decision is, so people will have access to accurate information as opposed to rumors, et cetera. And I'm sure that you and the chair and PIO and stuff like that will do that.
Yeah, I totally agree. When I was speaking with Yolanda during the break, we were talking about a communication strategy that, of course, includes working with Suzette and her team.
Okay. Thank you.
Commissioner Powell.
Can you just repeat what the price was per week?
Yeah.
2.8 million.
It's 2.8 million. I can run down all the numbers
That's
for you.
okay. I didn't.
But the weekly is 2.8.
Thank you. That's all.
Okay, thank you.
You're going to be in contact.
Yes, I'll make sure I communicate to the board once I have information.
We're good? All right. Now I'm going to shift back to try to end and land this plane on a much lighter note. One, I want to say thank you all. you know, I have the best bosses out there. 9, I am proud to refer to you as my bosses, and I mean that from a respectful way. It kind of reminds me with the Ride the District sessions. You know, as much as it was about me learning about your passion to serve, it was just as important for me to start establishing connections with you. And I think we accomplished that. I sat at dinner tables, I had ice cream. I'm not going to call all of you out, but it was a really good experience to learn more about you, and it carried on into the 2-day retreat as well, that I'm really appreciative of that. As I stated in my open remarks yesterday, at least to my knowledge, this is the first time that this board has gone through this type of retreat where you are presenting your why and your passion to one another. And there's a risk associated with anytime you do something new and there's no blueprint. It can go really bad or it can go really good. And I think it's the latter, that it went really well. It's a huge success and certainly something that I believe we should continue to do. We'll define what the cadence would look like moving forward, but certainly I believe that we're on to something. Also, I hope you have developed an even greater appreciation. I say even greater appreciation, words matter, of what it's like to stand on this side of the podium. To develop, I hear some chuckles there as well, to develop a presentation, to stand before the governing body, to present with the media being present, to respond to sometimes challenging questions. I believe that you all have an even greater appreciation for that in working with our subject matter experts and assisting you with preparing your presentations. And to that note, I also believe by you partnering with our SMEs, our subject matter experts, that you realize it takes a very special type of person to do this type of work called public service. They don't do it for some type of recognition. They don't do it for financial reasons. They do it for the same reason that you're serving as elected officials, because they care. You know, I have the benefit twice a month of welcoming our new employees to this organization. And I always share with them that regardless if they're on the front lines working in HHS or in internal support, IT, HR, we all have one common role, and that's to serve this community as well. And I believe by you spending some time with the staff, the subject matter experts, you realize that they too share a similar passion that you have regarding serving this great community that we call home. I'd like to thank you for your ongoing support to allow me to do things differently. And it's my attempt to respond to some of the conversations that we had about collaborating and enhancing the collaboration between me as your manager and you as our governing body. I think we are on the right track, and those efforts will continue as well. And of course, any success that I experience, it's not me alone. And first, I want to acknowledge the entire team, you know, those that are still here, and then some that had to leave, and those that are watching online as well. I also want to call out a few individuals, and it starts with, and I'll just follow your lead, Chair Jarrell, the media production team. Those guys are rock stars. I know you've already acknowledged them, but we actually have a tradition that goes back to my days as budget director, where first thing I come in, we give each other a pound and kind of hype each other up, because I just really appreciate the work that they're doing, and it doesn't go unnoticed. They're rock stars in keeping you all and us looking good and making sure that we have very minimal, if any, technical difficulties. So I want to say thank you to the tech team over there. Also, Rebecca Herbert. She is, yeah, you can clap for it, that's fine. She is, I don't know if she's listening or not, but she was texting me earlier. But she's amazing and she's gifted. She's a long timer as well. Rebecca's been with the organization 24 or 25 years. And she's an amazing talent for this organization, and she's a natural at what she has been doing. The warm-up exercises, when done correctly, which she did, it helps establish connection, as you all have said, amongst each other. It's not just about the work, it's the relationships also. And yeah, there's been some times where the exercise may have not gone as planned, but I think Rebecca has nailed them on both days, and it helped feed into the comments that you are sharing with one another at the end of this retreat. Certainly the subject matter experts, there's too many to name, but again, they're the secret sauce in making all this happen and helping you all pull this off, providing you the data as well. Thank you for that. The clerk's office as well. Yes. I didn't get the memo to wear maroon, but the other clerks. Awesome. You already know how awesome they are. Along with the board support, Lisa and Chanel are not here, but they too are engaged with helping us. And then last but not least, before I take my seat and we go home, Mr. Sean Carter.
Yeah.
One of my favorite leadership books of all time, and I had my directors read this when I was a deputy director, is It's Your Ship. And It's Your Ship is a book that was written by a Navy captain. And the whole intent about it was having to operate in a rigid environment where all the decisions were made by one person, the captain. Well, the captain realized that production was not meeting expectations. And that's because he was making all the decisions instead of engaging his team. So as I admire and try to take in some of those leadership traits in terms of It's Your Ship, as I think about our conversations on how can we create this environment where you all have more time to talk amongst yourselves about your passion, about your why, to help give staff direction as we prepare for another budget cycle. And the chair and I was having those conversations. So the reason why I'm talking about It's Your Ship is because in that empowerment, in that decision making, the soldiers, they took more ownership in your ship. So as I lead this cabinet, I want them to know that Mecklenburg County is their ship. So hence why not only embracing Sean's thought, but you notice, I let him quarterback everything. I supported him from leading behind in running this, from meeting with all of you, providing you templates, checking in with you, sitting in all your planning meetings with your subject matter experts, because I want him to have ownership in this ship here, because he's a solid. Thank you for a job well done. And with that, Mr. Chair, that concludes all my comments.
Thank you, Mr. Manager. At this time, we'll entertain a motion to adjourn. Moved and seconded. All those in favor say aye. Aye. Meeting adjourned. Thank you.